Let's see. Yeah. All right. Hi, Trans Alpine. Hello.
Hi.
Hello. How you doing this morning?
Not the best. My head really hurts, but other than that, I'm doing alright. How about you?
I'm doing all right.
Oh, not a freaking pop-up printing over some of the
Oh no.
the notes that I printed. I just realized that
Oof.
I'm not going back inside, so
I think I made them pretty reasonably sized. I don't know.
yeah, it looks good to me. Other than that stupid freaking, like I said, pop-up thingy that printed in the bottom corner of the first page.
Yeah. Yeah, I forgot at the last minute too that I kind of went through and took some notes about the humanities and economic burden of conversion therapy among LGBTQ youth in the United States because it also talks about the savings from doing affirming care. So
Mm-hmm. Thanks,
plot twist.
Astrid.
Plot twist, helping somebody out and making them feel comfortable in their skin makes them have better life year or have more quality of life years, and it costs them less.
Yeah, wild how that works.
Ooh, actually, hold on. I might not be able to do. I might have to end here because I don't know how do you
I don't
how
know how to do it
do
either.
you
Don't ask me.
co-host on TikTok Live Studio?
If we can't figure it out, we can always just let her know and do just like a normal live too.
Yeah. Um, do I have to? I might have to plug in this camera source, which is kind of dumb. You will hear Windows sounds for a minute here, potentially. You plugged. Okay, so that's plugged in. Uh,
Thanks for helping us figure that out. I don't know if you saw the comments, but um, Gay Michael said to do a battle debate, I'd have to go live and not be on the panel, and I don't have enough followers for that. So it wouldn't be between Keaton and I, though. I don't know if you get that. I think you were hanging out in the comments yesterday, Gay Michael. So probably. Um, but yeah, Christie definitely brought up having someone with her to help, and
Yeah.
Keaton would probably prefer to have somebody up here to help along the way as well. Um, so I don't know if there's a way we can do that without, like, either with the like battle style or without it. She can always, like I said, if we can't figure it out, she can always just join like a regular live, and we can do it that way. Her and her friend, I should say. Can't remember who it is, but she did want someone else
Oh,
to.
you have to have a minimum of 1,000 followers. Yeah, that would be probably why.
Yep, it makes sense now. She's probably just gonna have to hop on over here again.
Not the little polecat. I was looking at the video of the polecat I sent you, the little marbled one.
I love that. They were so like still. They were just frozen. Like somebody sees me, I can't move. Apparently, 1,000 followers is the old requirement.
Oh,
I have
um,
no idea. Yes, Astrid, that's what I think we were talking about doing yesterday for today. Do you want me to drop and see if it like gives you more options and stuff?
no, it doesn't give me. It didn't give me any more options. Um, yeah, I see it, but it's grayed out for me, and I don't know. Like, it's not giving me any information of why. Um, Actually, why don't you drop down real quick?
Okay, bye.
Lily, I'm dropping you for a second. Okay, so yeah, I could co-host. Yeah. Um, yeah. So Chris is going to share the live with me, and I should be able to co-host that then. Make sure it said that. Make sure you're following Christie. Cool. I don't know if you saw that. You do. You have 50. I think is what you need. Oh, it doesn't though. We're feeding into mental issues. Well, that would be a problem. Because the data suggests otherwise. Like it's very clearly the other way. Like it's pretty actually overwhelming that it leads to better outcomes by affirming than no, it's not skewed. It's this is among like looking at like metadata of even it like costs less money for individuals. So I have no science to back this up. I could look at like the humanist. I have one, two, three, four sources just off the top that I have in my notes. So the studies that I'm talking about don't even look at just actual hormone therapies and gender affirming care that are like medical interventions. It's also looking at like just social interventions, and that shows among children that their depression and anxiety rates essentially drop down to either identical to their peers and the general public or the general population, or slightly elevated in the case of anxiety, but it's still below like clinical levels. So no, we shouldn't. I don't know what you're going on, Robert, but no, we shouldn't do that because that's actively harmful. Yeah, the cost effectiveness is kind of a wild point too. It actually leads to, on average, $97,000 more for somebody who goes through sexual orientation, gender identity change efforts. Um, they don't reduce bone density itself. They reduce the BMAD score, the Z scores, um, which actually isn't measuring the bone density itself. It's measuring how your bone density compares to uh, the like general population of people who are the similar age, sex, and ethnicity of yours, or have similar ancestry. That's how it's worded. And when people are putting on gender affirming hormones, these either largely catch up or are only slightly behind in terms of Z scores. So if I'm right, I should be able to go co-host. I should be able to invite you. Yes, give me a second. So does Cole need to go live now, or how do we do this?
Yeah, go live and then I'll invite him
Okay.
later. Yeah. I'm good, thank you, Pebble. Top of the morning.
Top of the morning to ya.
I guess it's gonna be like a battle type of thing, right? We'll do like a battle.
Yeah, I don't know. Yeah, we could have like a battle.
Okay. Morning.
But just before we start the debate, when the other guy comes on, I'm just going to make a quick little thing to let everyone know that my groceries are just arriving. They're like 2 hours late, so I'm going to have to get the food on, and I'm so sorry. I'm just going to have to be running up and down. Mum's coming back from dialysis as well soon, so I want to say apologies for choosing it on the wrong day for me. But yeah. So
sorry for scheduling it on the wrong day.
No, I could have said no, innit? But I'm like, yeah, let's do it. Do you know what I mean?
Yeah. I'm just gonna wait for the other. I'll put music on. I'm feeling it. Music too loud. Hi, Nate. Morning. Morning.
Oh my god.
Good morning. I'll grab back from you one second.
And guys, if you are in here and you haven't followed Christie or just, you know, thing with Christie, please hit her with a follow.
Just give me 1 sec.
I'll give you 2.
1 second.
Oh, Mitchie, I think I'm going to, maybe if Nate's live, oh, no, he's not live on Sundays, is he? So maybe Monday, me, Nate and Christie can do like another little collab on his live or something. Because I know you guys enjoyed it. Oh, Nate has a debate tomorrow. That's dope. I know what I'm going to put on just to wake everybody up. This is to include, like, you know, the women who want to be men. W, pump it up. W for the pumping.
You want to just go in your panel? How would it be? Would it be easier to do it that way? That way we're all in one live.
Can we do your panel?
Yeah, I can.
Please.
We can do that. I'll just.
Oh, do you want to go in your panel,
Let's just go in there, so that way we're all in one live.
Yep.
Okay. All right. Okay.
Guys, let's just follow
we
Slow
can do
Tea or
that.
follow us.
Yep.
Okay,
All
let me
we'll do
follow.
that. Okay.
Yeah, it's better that way. Bye.
How do I leave the co-host thing? Can you kick me, or do I have to?
Yeah, I'm just gonna end the live.
There we
Top
go.
right, Stowe.
I got it.
Sorry, bottom left.
Okay, there we go. Okay, so now I can
I'm here.
I can hear you fine. I'm trying to get colon.
Yeah, we're like all scattered, so it's probably better just in one panel. That's why I said come in mine.
Yeah.
But it's okay. I guess I'll leave it.
Well, I didn't copy that right. I'm trying to give Cole a direct link if it's easier for them. So.
Right, my groceries just got here, so I'm going to run down and start getting that all together. Christie, I've got my other thing. Can you message me, and then I can run back up if I'm,
No, you're good. I'm here.
Yeah.
I guess we picked a bad time today. Oh well.
There we go.
Hi.
Morning.
Of course, now the app wants to be weird with me and not let me do shit. Okay, I'm gonna have to close and come right back.
Okay. Oh, I can stop that because I don't need that.
All right. So far, so good. All right. Hi.
So we're just waiting for Envy then?
I don't know.
Christie's muted. I don't know if you knew that.
I was about to say, I don't know if she knows if she's muted, but yeah.
I was just talking to my kid.
Yeah, I figured you're smart enough to know if you're muted or not on this app. You
Yeah.
seem to know how to use it enough.
We could start if you want.
Yeah. So the two things we did agree to talk about were bone health, or puberty blockers and bone health, and then affirming gender leads to better outcomes, at least for our side.
Right. Okay. I mean, you want to state your claim, and then I guess we'll do your sources, and then we'll do mine after.
Yeah. So from all the sources that I've read, in terms of puberty blockers and bone health, they basically state that so bone mineral apparent density is the measurement of the bone. I don't know how it's exactly done, but it's measuring the density of the bones. And these are often compared with the average with individuals of similar age, sex, and ancestry, and a Z-score. And often, what's confused is that a lot of people will conflate that the Z-scores means that when the Z-scores go down, that the bone mineral density is going down, but it's actually not. It's staying the same. It's that bone density for individuals just on puberty blockers practically does not change. So the first source that I'd probably do is, let's see, do I have a, it was published in the Journal of Clinical Endocrinology and Metabolism.
Endocrinology, you got this.
Endocrinology. I'm trying to see if there's a, what's the easiest way to give you a copy of it. It's the title is Bone Development in Transgender Adolescents Treated with GnRH analogs and subsequent gender affirming hormones.
Okay, 1 second. I have a lot of sources here, and I have a lot of stuff that shows. Let me see. 1 second.
Is it showing that the Z-scores go down, or is it showing that actually the BMD or BMAD scores?
Well, there's this. I think the Z-scores is what they compare to people like your age, right? Like your peers.
Yeah, but the Z-scores don't matter when, go figure, you're stopping puberty from happening. You're going to expect the bone development to stop as well.
Right. Hold on a second.
But that does not mean that the bone is getting worse. It's just remaining the same.
Right. Let me see.
Yeah, one thing we were talking about yesterday is that the bone health doesn't decrease, it just stagnates. So I think that's one of our big claims out the gate here.
Mm-hmm. Let me see. Hold on a second. It's hard to not have envy here when we're going back and forth because I have to read and I also have to find. So give me a second. Give me 1 second.
Take all the time you need.
Yeah. Sorry. Hold on a second. Okay, so let's see. Where are we here now? Sorry, guys. I'm a little slow this morning. Bear with me. So, what I have here for the side effects of gender affirming, well, I just use puberty blockers. Longer term use of puberty blockers, we have a decrease in bone mineral density, bone accrual, slower growth, delayed height increase, potential for decreased final adult height. So this all has to do with actual bone and the density too. And then there's other, obviously, side effects. So increased fat mass, decreased lean muscle mass, fatigue, tiredness, emotional changes, mood swings, breast tenderness, reduce sex hormone levels during suppression, reduce gonadotropin levels while on blockers, genital growth, effects on genital growth, impact on fertility, gamete maturation, need for increased monitoring of bone health, calcium, vitamin D, physical activity, changes in body composition, possibly delay in pubertal maturation of secondary sex characteristics, which we know that's what the whole point of it is for. More frequent monitoring labs, and then it's unknown long-term effects on adult health and fertility, the medication side effects. They also apply through less specific data. So I have a source here. Let me just pull this up and you can see it. It's psychological and physical health outcomes. It's MVPI.
PBI.
It's a let me see. It's physiological and physical health outcomes associated with gender affirming medical care for transgender.
You have a Discord, right? Do we just want to link each other's sources? Yeah. Okay. Yeah. What's your Discord?
Hold on. It's Christie, CHRISTINYC.
Also, Christie, I'm wondering what the length of use of puberty blockers is that's being studied in that as well. I'm sure Keaton can figure it out as well once you guys get connected and can send things to each other easier. Yeah. But that's my main question at the start of that.
So I see over 2 years.
Okay, that's fair. As long as we recognize that the W path doesn't want for trans individuals, and it is practice that the trans individuals do not take puberty blockers for more than 2 years.
How did you spell your username on Discord? CHRISTIENYC?
No E.
Oh, got it. That
Yep.
would be why. There we go. Okay, I sent it.
Okay, give me one
It'll
second.
just be from
Go back.
Stitsky, so.
Let me see. Okay, I'm gonna accept you now. Sorry guys, I should have got myself a little more prepared this morning. I had a long night with the baby here. But let me just get my we should have friended each other yesterday and got all this taken care of.
Yeah, to be fair, yeah.
Yeah. So we're good. Okay.
There's that source to begin with.
Okay. One second. I also have a source that shows that people that are kids that are on blockers that are transitioning go on for longer than kids with precocious puberty. But I could send that. Let me see.
Well,
And I also don't see
if they're not going to be allowed to go into like gender affirming hormones, which is usually the reason why they don't continue on, or like that's would be logically the next step is for them to go into gender affirming hormones. But if laws prevent them from doing that, it makes sense that they're going to be on there for longer.
Right. So the W path, I don't think, from my understanding, also doesn't suggest it should be only 2 years. I don't see, like, the W path SO8, the standard of care version 8, there's no explicit statement that says that they must be limited to 2 years or less. Let me see. And
Okay.
they could start as young as 9.
Well, that just depends on. Oh, hang on, my front door's hanging open, and I don't know why. But that depends on when they meet the. Okay, my dad got it. That depends on when they meet Tanner stage of puberty that is required for them. So it just depends on when their puberty onset is. And even if it isn't in the W path, I'm sure that you can find, at least in my experience, and I mean, I know trans people from across the country, so in a few different locations across the country, it is pretty common practice. Endocrinologists don't want people on puberty blockers for long term, and typically they would consider long term over 2 years, like that study you referenced does as well. If they can help it. You know, if precocious puberty is the problem, then they might stretch it to like 3 years. It can be situational, but it is pretty common practice that they keep it under 2 years if at all possible.
Okay, because I like I said, I don't see. I do see. They try to do 1 to 2 years maximum for precocious puberty, and then they also acknowledge that there's a possibility of bone density issues. Well, not a possibility. There is bone density issues also in girls with precocious puberty, because I think I said this in the other live too, and I'll send you a source that in their late teens, early 20s, they suffer from osteoporosis. Now, when it comes back to W path, like I said, I don't see a fixed maximum duration. If the kids do go on to wrong sex hormones, they can still be on blockers from as early as 9. At Tanner, actually before Tanner stage 2, even though it says that they start at Tanner stage 2, it also says that they can start prior to Tanner stage 2, but they'll be sterilized for life. So I don't see anything, like I said, for 2 years max on here. It says, it actually says individualized decision making. I could send you that.
Yeah.
Later, too.
So that's fine too, and I may have like misreferenced at first in like how certain I was that was a part of the W path itself, but that's when I re-clarified that it's common practice that they try not to go over 2 years. They try to keep it as low as possible because doctors are aware of these issues. They bring it up every time that they even consider putting a patient onto puberty blockers. So
do you have something that shows that they try to keep it under 2
well,
years?
even didn't you just read some of the W path that says that they try to keep it under 2 years? And I know that you may have been talking about precocious puberty in that scenario too, but
it says W path is not prescribing a fixed maximum duration for GnRHA monotherapy. Instead, they emphasize individualized decision making. So it's up to the person, actually.
yeah, okay. Keaton, did you hear when Christie said previously was talking about precocious puberty and
Oh,
said that they try
precocious
to keep it
puberty, they
under
try to
2
keep
years.
it. Yes,
Puberty,
1 to 2 years. Yeah, for precocious puberty. Yeah, I misspoke.
Okay.
Yep.
It's a pretty standard, like across the board, no matter what you're using puberty blockers for, that they try to keep it under that.
Yeah, but
And
then
again,
WPATH isn't demonstrating that on their website, right? WPATH
I
would
agree.
demonstrate that on their website and say what we would like to do is keep puberty blockers under the 2-year mark, rather than saying, hey, it's individualized and it depends or varies from child to child, which means they're giving a lot of wiggle room there for it to be a lot longer than 2 years, a lot less. So they're not putting even a ballpark figure on it.
And it also says you're supposed to acquire bone density during puberty, and it stagnates, and it's not supposed to stagnate. So the source that I sent to you will show that too.
It
It's
only
supposed
shows
to-
that the Z scores are lesser. It doesn't actually talk about the. So the problem here is that you're saying that the bone is getting worse, but you're comparing it to people who are going through puberty, which we expect to have an increase of their bone mineral density. We don't see the bone mineral density getting worse. It stays at the same as if you would expect that somebody wasn't going through puberty. So
Exactly.
nothing's actually getting worse. It's just that when you're comparing to people who are going through change versus people who aren't going through change, go figure, they're not changing.
So I think a better comparison would be to compare patients who have been on puberty blockers in the past, but are going through or have gone through puberty since they stopped them, whichever puberty that may be, to compare those patients with patients that don't take puberty blockers who are in puberty or post-puberty. It just isn't accurate to compare prepubescent bone densities to post-pubescent bone densities.
And we shouldn't be looking at Z scores if we're trying to see if somebody's bone health is staying the same or not, because that's just comparing them to other people that are going to be going through puberty. We're
Well,
explicitly not doing that.
Well, I mean, when you look at Z scores, like I said, it's comparing to your peers. So even if they're using blockers, right? Their levels. If you're saying that if it's a healthy way to do this, their bone density shouldn't stagnate. Now, so when I'm looking at this, it says the
Wait,
BMAD.
You're saying it shouldn't stagnate? Are you expecting
No.
people who are not going through puberty to have puberty?
No,
that's what.
it's just a smooth increase across the board. So let me just explain. When you look at the BMAD, the LS, the Z scores, it says on the study that I just sent you, it decreases significantly in both boys and girls, and the FNZ scores, the femoral neck, decreased in boys, but not significantly enough in girls. So it actually shows that there's a decrease, it's not a pause. It's actually getting worse in the study that I just showed to you.
Everything is talking about Z scores here.
Yes,
Nothing
but
about
Z,
that.
but Z scores are what you're going to have to
compare-
use. Go ahead.
Oh no! So the Z scores are comparisons. What you want to look at is how measure the bone density repeatedly to see if it's getting worse. What we see is it doesn't get worse; it stays the same. That's the problem.
Not in the study that I just showed you.
No, because it's only comparing the Z scores here and the results.
Right, but
Yeah,
why would it shouldn't get, the problem is it shouldn't get worse, right? It should stay exactly the same.
It doesn't.
But the
because
Z
the Z
scores
scores are
are-
inaccurate. They're comparing prepubescent and postpubescent people. We just went over how that you're not going to see an accurate comparison between prepubescent and postpubescent people, regardless of their use of puberty blockers or not.
But my claim is it shouldn't get worse. It should
It
stay the
doesn't.
same.
So
That's my
wait,
claim.
no. But what you're trying to say is that people who
I'm
are
not
puberty
saying.
blockers.
Wait, let me rephrase. When you're looking at a kid that's going through puberty and a kid that's paused, their bone density should not be getting worse. It should
doesn't
stay the
get worse.
same.
It stays
It
the
does get
same.
worse. That's the
No,
study that I
because you're
just
comparing.
sent you.
Okay, so Z scores are comparing. So let's think about this logically. If I have a card that stopped, two cards that are stopped, the position from the start line is going to be the same initially. But if one starts slamming on the accelerator and starts going, essentially your Z score in that situation would be getting worse if you're comparing the card that was stopped versus the one that kept going. That's what a Z score is measuring. But what
that's
we're
not what
not
it's
seeing.
saying.
What we're not
That's-
saying is we're not seeing that card going backwards. We're seeing
But
it
that's
stay
not what
there.
it's saying. It's actually saying in this study that even if you're comparing it to a kid that's going through puberty that's on full throttle, right? their bone density themselves is actually decreasing, not staying the same. It doesn't. You can look at the Z-score and it'll say have a number there.
It's
And
decreasing
after
compared to their peers.
it's decreasing in general,
No, it's decreasing compared to their peers.
not
That's
not
what a
from
Z-score is.
not
That is
not
what
in
a
the study.
Z-score is.
I know what the
What is
Z-score
a
is.
Z? So what is a Z-score then?
The Z-score is the bone density compared to their peers.
Okay, correct. And their peers
Yes,
are
I
going
know,
through
but that's
puberty.
what I'm trying to explain to you. Even comparing to their peers, if you're going to compare it to their peers, they're decreasing on their own. Let's forget their peers for a second. If you're looking at a kid that's going through puberty, right? They're going to go up, their bone density is going to get better, right? It's going to increase. A kid that's
Yeah.
on blockers, their bone density is going to decrease. So it's not going to stay, even comparing it to another child, their numbers are still going down. They're still decreasing. Not only to compare to another child, even if we took that child out of the equation, they would still be decreasing. Their numbers would still be going down. That's
The
my
only
claim.
way you
And
can
that's what
take
the
the
study that
other
I showed you shows.
the only way that we can take other people out of the equation is if we don't use Z-scores.
That's
That's
not
what we're
true.
trying to explain, because Z-scores are comparing pubescent children and prepubescent children because
Yeah.
it's their peers. So the only way you can take the other people, the pubescent people, out of the equation is to not use a Z-score. That's what we're trying to explain.
That's not true. You'd have to use a Z-score to have a base, right? So if your base is 10, and then the kids that are going through puberty now are up to 20, and I'm just throwing a number there. If we are starting at the number 10, right? The kids that are going through puberty are now at 20, 30, 40, 50. The kids that are on blockers are now going to 8, 6, and 5. Their numbers are decreasing. So even compared to another child that's going through puberty that's not on blockers, their numbers are still going down. That's what my study shows. Their numbers are going down. They're not staying the same compared to another kid going on blockers. Their numbers are decreasing while it's going like this. That's what I'm trying to explain. I'm not sure if I'm explaining it properly. They're going up, the other kids are going down. Yes.
So on this is a graph from the study I linked. This right here is looking at these top two are not actual Z-scores. These are Z-scores. You can see the Z-scores are going down, but the standard bone density is staying the same or getting better.
Hold on. But did you look at mine?
Yeah, but yours is only talking about Z-scores. It only talks about Z-scores.
Again, you're not. I don't think you're understanding what I'm explaining to you.
Z-scores don't matter.
Let me try to pull it down. Let me try to pin it for you. Give me a second.
Z-scores simply don't matter.
Also, yeah, Christy, when you're saying that that you have to have a baseline, we're talking about having watching one patient at a time and comparing their bone health to prior to being on puberty blockers, while they're on puberty blockers, when they're off of puberty blockers, and then after they've gone through puberty. That's how you get your baseline. It doesn't necessarily need to have a comparison to anybody else as well.
That's just simply not true. You would have to have a baseline. You can't. You wouldn't know that they're decreasing if there is no baseline.
Yeah, you measure
You would
from
with
one
those
point
patients. Exactly. And
to
then
another point.
your control would be patients who aren't on puberty blockers, who just go through puberty normal. If you're looking for a control to compare it to, we can do that without having to necessarily look at more than one person at a time, if that makes sense.
If you go to my study, if you go to discussion, the GNRA administration for more than 2 years during the physiological time of puberty decreases bone mass acquisition, mainly at the lumbar spine, and induces a general increase in fat mass. Although lean mass acquisition is undermined in both groups, hand grip strength is affected mainly in, I don't want to say trans, in boys compared with age-matched peers. So it's specifically stating in this study that it is going down. So I know you're saying that your study is showing that it's not. This is specifically saying that in the lumbar spine, hand grip strength. Let me just read. Hold on one second. It increases fat mass, and then it decreases in mass acquisition and undermine both groups. So go to the discussion line. Yeah, and I'll send it to you.
That study.
I'm gonna send it to you right now.
His one, yeah, and the one on the backdrop.
Oh, I'm gonna send you mine, the one I'm reading from, and then I'll send you his. Hold on.
All right, thank you.
But I'm trying to explain that even if you're looking, my study still shows that it's going down. The numbers are decreasing, so the bone density is going down. even if we're looking at the Z scores or not. Hold on, let me just understand.
Okay.
we don't want to be looking
Can
at
you
the
zoom
Z-scores.
out just a tiny bit so that
Is
I
it?
can see for at least for iPhones. Yeah, that's good.
Yeah,
Okay.
it's a left hand side that gets cropped off for whatever reason.
Yeah, I don't know why either, but now I can see it. Thank you. And now when you go to explain things, we should also be able to see better.
So duration of treatment months.
So this is over 2 years.
Okay, can you tell me describe the first one to me? It's a little blurry. Maybe it's my glasses. Hold on. Let me see.
I can just expand it too.
Okay, go ahead.
So this is looking at the BMAD LS, so that's the lower spine scores. And what you can see is that, and that's in grams per centimeter cubed. You can see
what is each line indicating? Like what is that? What does the line mean? Yeah, I need to see that.
Trans boys early, trans boys late, trans girls early, and trans girls late. And that's looking at how did they break that down? It should be all in the source, obviously.
What's your bottom left? Andrew, that one's mine. Let me see the bottom left. Can you move your screen over?
The bottom left is looking at the Z scores, so that's
right.
Obviously going to go down. That makes sense.
Go to your top right.
That one is slightly. It's that's going to be FN, which is.
What's FN?
Yeah, that's what I'm trying to find.
Let me open up your study. Hold on a second.
Yeah, please send it to me too.
Yeah, let me just open this up. 1 second. Okay. All right, I'm sending it to you now, Andre. I'm going to read through the study. Can you give me 2 minutes? I'm not sure if she's here.
Yeah. I want to have a look at it as well. Understand what we're looking at here.
Yeah. 1 second. All right, I'm sending it now. Copy, MV. Okay. All right. Give me a sec. Go ahead.
Fetal neonatal, I guess. Potentially. Wait, no, that's not right. What is?
Wait, what would neonatal have to do?
Yeah, I know. I'm trying to just find something about what it. Oh, femoral neck. That's what it is. It's explained in the figure description.
Let me see.
I think it shows it in the results, it does go down. It does say at the beginning of treatment, the mineral density and values were within the normal range in all groups, but it does show during the 2 years, it's either stabilized or it does show a small decrease, whereas during the 3 years, there is a decrease. So your study isn't showing that it's stabilized throughout or improving or anything like that. It is showing long term, 2 to 3 years, there is a decrease. So I don't understand what you're proving here.
I'm also seeing if I'm reading this study, do they show if the people had low bone density prior to starting this? And let me see.
Well, they're only comparing it to themselves. So they would compare. So they would take my bone mass and put me on puberty blockers, and then monitor my bone mass just compared to myself. We're not looking at Z scores, so we're not looking at if I already had low bone density. We're just looking simply at.
Wait, is this study showing bone density or is it measuring bone turnover markers? The P1NP, the osteocalcin.
It is measuring.
That's bone turnover markers. I don't think it's measuring bone density. I don't think it's I don't see it. You see, it's showing bone formation or reabsorption. It's not.
Where it says BMAD, that stands for bone mineral apparent density. So every time you see BMAD on the side of one of those graphs, it is talking about bone mineral apparent density.
Let me see. Z squared is repeating.
so they use bone density or dual energy X-ray absorptiometry for it.
1 second. Let me read it again.
And is this about cross-sex hormones or puberty blockers?
It's about
Sorry.
both. It's talking about, so this one right here that I have up
Because
is
it's talking
currently,
about hormonal interventions. I don't see where it says. If I'm not seeing it, could you point me to where it states that this is about puberty blockers?
let's see what does figure 1 say. It's GnRHAs are puberty blockers.
Okay, right. Thank you.
Let me see.
This first part of the study is looking at people who are on.
Oh my God, no, but this is a combination, isn't it? So it's not just. So what they're doing is they're studying or taking a look at the puberty blockers combined with gender affirming hormones.
Well, they look at the puberty blockers, and then they also look at what happens when they are put on hormones. And what happens when they are put on hormones is that the Z-scores mostly get up for, I think everybody except for, who is it? There's one group that didn't quite get back to, the Z-scores back to normal levels.
I have a question, Keaton.
Yep.
With Z-scores, would it be best to describe it as kind of like a percentage of where you should be, or where patients typically are in that age group?
Yeah, so it's comparing you to like your, like if you're like overweight for your population, it's looking at your age and sex and your ancestry, and comparing.
Yeah.
it
So
to,
sorry.
So the problem about the Z-scores is that it's literally comparing people who have not grown up to people who have grown up, because that's what puberty
So
is.
my question about the percentage though is that, like, if you have somebody on puberty blockers, let's say from like 10 to 12, at age 10 they might have the same Z-score as their peers. At age 11 they're only at like 90% of the development that the other 11-year-olds would be. So that would be why. And then at age 12 they would be being maybe at, and I'm just throwing out random numbers, they'd be maybe at like 80% of what everyone else would be. And I think that can describe why the Z-score would go quote unquote down, because that percentage of where they normally would be had they not been on puberty blockers, that percentage of getting to that is lower, even though their bone density is stagnant, if that makes sense. I think that's a way that helps me understand it better, if it's accurate.
Part of the problem too, that at least in this study, is that they didn't actually, they pondered which would be the more effective group to actually compare Z-scores to. If it's more effective to compare like the trans woman to females, or if we should be comparing them to men or to males. And I think
Yeah.
it's comparing. It looks like they're comparing trans women to males, which kind of is. You wouldn't expect, if you're on estrogen, you wouldn't expect your bone density to increase in the way that are in line with going through male puberty.
Exactly. That kind of shows a different methodology than I think there necessarily should be, because hormone profile definitely determines, like, that is one sex characteristic that can certainly determine a lot of like your bone density and such. So that's something to keep in mind as well.
I'm still reading this study. It's pretty long. Give me a second. It's again, it's still showing a significant decrease.
In BMAD scores, it's not actually showing the actual, or the Z scores show a decrease, but not the actual. They don't show like significant decrease in just straight up BMAD. That's the problem with all these studies, is that everybody uses Z scores when you really shouldn't be doing that, because you're literally comparing people who are just not analogous to each other anymore.
But I don't know, I keep repeating that you need a baseline, so you would have to
Yeah,
compare it
your
to
baseline
a healthy body.
is when you start is before you start puberty blockers. That's going to be your baseline.
No.
No, but you have to compare it to your peers, right? So that's how we
No.
establish an average.
So
No, not necessarily. Okay, so two things.
so
One,
if you're wanting to
these
hold
aren't
on,
really peers in this case. Okay,
yeah.
I'll let you remember.
Yeah, so if you want to know if my bones are getting weaker or stronger, what you do is you measure my bone density,
Okay,
and then you measure it
right.
again and again,
Right.
and then you
Yeah, I
compare it.
understand. I understand that because you're doing it at an individual basis. But let's
Yes.
just say you go to the doctors and you have your bone density checked, right? How does the doctor know whether it is in a healthy range or an unhealthy range?
In
It's
that
because we
case,
as a society, the medical industry, have established what a healthy range is for bone density.
we have
That's how
established what
they
the
know whether
normal
you are in
range
a
is.
healthy range or an unhealthy range. So
It's
how are we going to identify? Because there are people who do get osteoporosis that are not on puberty blockers, correct? We know that these things can happen.
yes.
Okay, so how are we able to identify that if we don't have a baseline to say, right, the average health range is whatever it is, right? So then how would you know the first time that you go whether you are in a healthy range or an unhealthy range? Because that would essentially affect how you're treated medically also.
Well, at that point, you should be comparing yourself to like a Z-score that's based off of people who are on puberty blockers as well.
No, it has to be for
Listen,
those who are not, because we need an average across the board. We
Yeah,
need to
there's
know, right?
lots of people who go on
That
puberty
typically a
blockers.
healthy range is like this. Now, those who are going on puberty blockers seem to, after X amount of time, decrease, which is now putting them in an unhealthy range. We carry this out across everything. Like this is how we know. We do it with vitamin D levels, vitamin E levels, your IgG, IgM, IgAs.
so
We need to have healthy and unhealthy ranges so we understand, so we can give a diagnosis to people
I
on their health.
Yeah,
I don't think
and then
that
in
It's
the
the.
like
study
it's like
Can
saying
I
itself,
please chime in for like 2 seconds? Thank you.
I
Um,
just have one statement I just want
I
to make really
I
quick.
don't think that the
It's
host and I disagree that it's medically helpful. Okay, go ahead, Christie, and then I'll continue.
It says after 2 years of GnRH, the study reports that all four bone markers, P1NP, P3NP, osteocalcin, and 1CTP, significantly decreased in girls and in boys and early pubertal. They're saying trans girls and early pubertal trans boys. The authors interpret this. Let me see. It's a reduced bone turnover. It's suggesting that the decline in bone marker levels may partially reflect a slower bone formation rate
Yeah, I mean, I guess.
and a change in bone density. It literally is showing it in the study that you just sent to me.
Do you
I mean,
think
like, we could
that
even argue from the point of a healthy weight range, right?
All four markers show it that it
do you think
decreases.
that males and females have same healthy bone density ranges?
No,
Okay, so why would you expect a trans woman who now has a female hormone profile to not have a similar like it's going to show it goes down because they're still considering this woman to be a male, which in some ways she is, but in other ways, including her hormone profile, she's not.
wait,
So
that's
Right,
why
not
would you
and
expect it to?
the male body is not designed to have heightened levels of estrogen. This is why it causes those effects, and vice versa. The body's not designed for
No,
that.
it's just because females typically have lower bone densities. I would
Right,
be
but the
almost
thing
certain
is,
about
a
that.
female with average levels of estrogen is not at risk of osteoporosis. A male with the estrogen levels at that range, which it would be lower levels of testosterone, would be at risk of osteoporosis. Because again,
Ex-
we are biologically different. Our bodies are not designed, a female body is not designed to have that level of testosterone. That's why women have like PCOS and other conditions that come along with that. That's why it's considered a medical treatment.
We aren't
So,
designed.
yeah, we
so
are
No, we're
absolutely
listen,
absolutely
designed.
not.
this
You would
is
have to
my
prove
this
that
is
there's
my
a designer,
question.
and I
What do you
don't
mean?
think you. We're
Prove
not
that?
designed. There's no designer. Design implies creator.
Okay,
There is
okay,
none.
then all right, then we're gonna end up going into a religious thing, so we can.
I was
just
about
back
to
it.
I'd be
say,
more
do
than
we want
happy
to
to
go
slam
into a
on
god
you
debate?
on that because gods
But
can't exist.
this is my point, okay? When a male person takes on a female hormone profile, whether you think their body is quote unquote made for it or not, we would expect to see the bone density of a female because hormone profile is what
Right, and the bone density of a
leads to bone
female.
density. And they're still compared to males, is what
And
I'm
the
saying.
and the
So they're
bone
not going to be
density
in
of a
normal, quote
female.
unquote, typical male ranges. Can you, like, maybe let me finish? The quote unquote typical male ranges they're going to fall out of and they will fall into quote unquote typical or normal, whatever, however you want to say it, female ranges because they have a female
Right,
hormone profile
right,
which affects
okay.
their bone
But
density.
the difference there is the female at that level is not at risk of osteoporosis and losing bone density and minerals, whereas the male is. So
And the
again, there
reason
is
is
a difference. We just showed
the
that in your
cis
own
woman
study.
didn't start out as a male. So they didn't start out ever, they were never compared to males. And if you did, the woman would have low
Female,
bone
I
density
think. Oh, go ahead.
but
for
he's not getting what I'm
for a
saying,
male.
Christie.
But
So
the,
if you were
but
to actually to do that, you would make the correct comparison. If you were to compare female women to the normal male ranges, they would be below there, just like
Right.
trans women.
But when that woman is below, females across the board, although our bone density is lower than the males, because of our natural producing estrogen, we are not at risk of osteoporosis. Right? We're not losing bone density within our sex species.
The
It is
only reason you aren't
averaging
losing
out,
it is because you didn't
right?
start as a man. I
That's
don't know
my
what to tell you.
point.
that's
That's
our
the
point.
point. That's my
Like you didn't
point.
like I think I mean maybe it sounds like we agree on one thing if you can agree that the reason that trans women's bone density goes down is because they medically transition and they started out with a male hormone profile. If you can recognize that, then we agree on this part at least.
Yeah, but the thing is, you're saying that males are supposed to. You're not taking into account that males that have a female bone density is unhealthy. So let's remove gender identity aspect from it. It's
Then
an
it's unhealthy for
number.
women to have it too.
Yeah, wouldn't women just
Wait,
have
say what?
Again, he's
80%
not
of people with
understanding it.
osteoporosis are women?
No,
Right,
we're not talking about osteoporosis right now. Women that have osteoporosis. We're talking about you're making a comparison with a male body to a female body, and then also saying that there's no decrease. And your study literally shows that it decreases in all four categories, all four
Okay.
bone markers.
So
So,
I'm telling you
which
right
figure
now
you're
that the
looking at right
reason
there?
it decreases is because I'm trans, and you can I'll go ahead, Keen.
What?
Sorry.
Which of the
Exactly. If you start out with a male hormone profile and then you have a female hormone profile, you're going to have a higher bone density to start. And then when you medically transition your hormone profile, it's going to go down into normal female levels. So
Okay,
it'll
right.
only
Okay, hold
drop
on,
because
hold
they
on,
had
hold on,
male
hold on.
levels
All right.
before.
Can I very quickly,
Oh
just
my god.
very, very quickly, right? So you're saying that the male that takes the estrogen goes down to the female level, which is between 15 to 58. That's the not 15 to 58. Sorry, my bad. For women, it's 3.0 to 40. Yeah, that's the healthy range for women. Now, when we're saying males, so you're saying that the males will go within the healthy range, which is 3.0 to 40, correct? So it will go down to the female level, yes?
I would guess that would be pretty
Right.
accurate.
Okay, right, okay. So we agree there. Now, and then when the male is in that healthy range of a female, the female's healthy range, he then becomes at risk of osteoporosis because of the bone density decreasing. Hold on. Now, for a female to be at risk of osteoporosis, she has to be minus 2.5 or lower. So then the ranges for osteoporosis between males and females are different because we are biologically different.
Well,
So a male
regardless-
in a female range of estrogen, right, is going to cause that density to drop for him, but not the female. In order for her to have a heightened increase of osteoporosis, it would have to be minus 2.5.
So,
I'm not
you do
arguing that
realize
trans people have the same mechanisms here. That's not the point I'm making. Things are going to be different biologically to an extent because you guys don't go through medical transition. I get that.
Yeah, but
But
your bones don't have gender identity.
I don't need to finish.
I'm sorry. Go ahead. My apologies. Go ahead.
This is why I really appreciate panel muting when other people are speaking. My point is that if you see a decrease, it's because they're falling into normal female levels. And when it comes to osteoporosis, anyone with a female hormone profile is going to have a heightened risk for osteoporosis compared to somebody with a male hormone profile.
No.
So thank you.
I'm sorry, you're misrepresenting
So
let
me finish.
Goddamn,
let me finish.
I'm
please.
sorry.
Because I'm curious to see what he has to say. Go ahead. Sorry, go ahead.
You would expect a lessened or a heightened risk for osteoporosis in anyone with a female hormone profile compared to anyone with a male hormone profile, because female hormone profile, if you have that structure, if you have that hormone profile going on, you just naturally are more at risk for that because you've got an estrogen dominant system rather than a testosterone dominant system. So even if we don't see them falling into the exact ranges to their cis counterparts, we still see their risk for osteoporosis go up a lot because they have a female hormone profile.
Okay.
That's a huge part of the equation.
No,
and they didn't start. I'm almost done. They didn't start with female hormone profiles. Therefore, they started with a higher bone density. So I don't expect these things to drop exactly down to their cis counterpart levels, but I do expect them to drop close to and have very similar effects like increased risk of osteoporosis.
Okay, right. Now, what I'm saying to you, when we have a female that is within the healthy range of her natural producing hormones, she is not at risk of osteoporosis, but the male would be. Now, in order for a female to be at risk or have an indication of osteoporosis, her hormone levels would have to drop below minus 2.5. Now, if you show me that it's not the females, there are 6,500 gene differences between the sexes. The female body estrogen levels, that healthy range, does not put the female at risk of osteoporosis. It puts the male at risk when he drops down to those levels. So when you take a male that has that level of estrogen, that level between, 3.0 and 40, and then you have a female at 3.0 and 40, the male is more at risk of osteoporosis than the female. But if you were to put a female that is minus 2.5 or lower, then she is at risk. So if you take a male and female at the same hormone profile, the male is at risk of osteoporosis, not her. Well, I don't get how you're not understanding this. Otherwise, every female would be treated to increase their bone density to avoid osteoporosis. The reason why we have that when we are going through menopause and things like that is to prevent us from getting it, because we lose the hormone starts to go down during menopause.
So I did hear you the first time that you said all of that. And if you were listening to actually the content of what I was saying and not just waiting for me to finish so you wouldn't be interrupting, then you would understand that a lot of what I said lines up with what you just said. So you think we disagree on certain things that we don't necessarily disagree on. I just have certain reason. We have certain reasoning that I understand and you don't seem to quite be grasping, which is why I tried to explain what I did earlier.
Hold on. Here's the problem
No,
though
but
too.
no, I thought your
Hold on.
argument was that when males, that you're saying females across the board are at risk of osteoporosis because of their hormone levels. That's what I thought you said. So if I misunderstood you, that's my bad.
If we took the if we took gender identity out
You
of the
did
equation,
misunderstand me, just to be clear. Sorry,
Yeah,
go
if we
ahead.
just
wait,
hold
if
on.
we took gender identity, let's take gender identity off the table. Would that change your perspective? If we looked at these numbers and we took gender identity out, it would literally
You
prove what we're
can't
saying.
because it studies trans people, so you can't. I don't know what.
Okay, let's pretend it's people. Let's pretend it's for precocious puberty. Would you admit that there's a risk there that bone density goes down? Well, forget being trans.
The bone
Well,
density doesn't substantially go down.
If we relabeled this precocious puberty, would you acknowledge
It
that
wouldn't
this
work.
What?
It's not
Of course
there's
it
a
would.
symmetry breaker. There's a symmetry breaker, which I can explain.
Wait, the symmetry breaker is somebody saying that they're trans. That's
No,
it.
No,
the
no,
symmetry
yes.
breaker is somebody actually having a female hormone profile after puberty blockers and still being compared to males. That's the symmetry breaker.
But
There
they
is
are
no
males.
cross-sex. Listen to me. They have a female hormone profile. I didn't say they were females 110%. I said they have a female hormone profile and they are medically compared to males, excuse me,
Mhm.
on that. And that is the symmetry breaker. You do not have anybody who takes puberty blockers for precocious puberty that in your scenario where we take trans people out of the equation, there is no cross-sex comparison being made in the studies. So there is a symmetry breaker. I don't know what else you want me to say on that.
Well, I'm just
Also,
saying you're
hold on.
comparing a male levels to healthy, like MB saying male levels to healthy female levels and saying that that's okay. If you compare those levels to other healthy male levels, those levels are completely wrong, and it'd be alarming to doctors. That's our point.
Healthy
Not
females
alarming to
are
doctors
still.
who understand trans people. Sorry, go ahead, Stowe.
So
But I keep saying to take trans off the table. Just take the word trans off the table. The numbers itself, the numbers
Symmetry
themselves
breaker
are
is still
dangerous.
there, and let's listen to host real quick.
Women in general, even at healthy bone densities, are at higher risk of developing osteoporosis. Flat out.
That was my point. Thank you.
Wait, say it again.
Women, even at healthy bone densities, are still at higher risk than men for developing osteoporosis.
Yeah, but that doesn't prove your point. You're saying that because they have a quote female hormone profile, they're going to be at the same risk as women.
He's wrong there because
I
a
know.
woman would only be at
Neither of us
risk.
said.
No. Women are at
So you
risk of
said women-
osteoporosis even with healthy bone densities.
Right. So it's saying here that it's primarily due to hormonal changes, right? Which is particularly in the event of the decline of estrogen levels, which occurs during menopause. And any other things that you take for your body, like.
But shouldn't this just couldn't you just take hormones to out? It's not. We're looking at the bone density here, and then you're saying it's caused by dropping of hormones. So what's the point here? If you're trying to say that this lower bone density is bad, and trying to say that it causes osteoporosis, that's one thing. But then you're also saying that osteoporosis happens because of estrogen falling off the
Yeah,
estrogen
because
levels
it's due
decreasing.
to hormonal fluctuations. Absolutely, that's why women, when they're on menopause, they take HRT to help prevent that from happening.
Yeah, estrogen deficiency is like the major driver of bone loss in women. That's literally what it is. Now you're saying that it's not only that. Like what else would you consider something major that can happen and cause osteoporosis aside from estrogen? Like it would be like family, like maybe a family history, or maybe if the person's overweight, right? Or maybe if they're smokers, or maybe if they're on medication. But these are all like other factors that have to be, you want to put these all in account too, but we're speaking about just the major driver of what causes osteoporosis in women is menopause. It's literally estrogen deficiency. So you're comparing these males to women by saying, oh, well, women also get osteoporosis. And because they're on par, it's okay for them to get osteoporosis at that level because they're matching women. They should be matching healthy male levels. They would not be at risk the same way that they'd be, not even close to the same way that they would be if they're taking estrogen. But that's the point.
What are you expecting?
That's the point of but that's the point of my argument. That's
You're
me and
expecting males who go through.
I'm sorry?
You're expecting males who go through a female puberty to have the bone density of a male who goes through male puberty. That makes no sense.
Can you tell me how a male goes through female puberty?
Yeah, they're on gender affirming hormones.
But what is female puberty?
At least in this sense, it's having estrogen.
That's no.
It's a puberty induced by a female hormone profile.
Yeah.
But okay, they don't go through female puberty. Men don't go through. Men don't, just like women don't go through male, like a woman can't go through male puberty because it's maturing sperm, right? Along with
no, that's not just what puberty is. We talked about this yesterday.
Yes, it's not just what it is, but that's like it's sexual maturity. It's when the people are fertile and fertile and they're able to reproduce. That's what it means. Their body is getting ready to be able to, to get pregnant or impregnate somebody. That's the point. So
trans people should be whittled down to our reproductive abilities.
I didn't say that. I'm talking about the word puberty. The word puberty is a category. The word puberty categorizes a state of development. Do you agree?
That's really general. Yeah.
Well, what else would you categorize puberty as?
No, I'm just saying it would be the changes the body goes through due to onset of female or male hormone profile.
But your body also goes through changes when you're 60 and 70 and 80. So can you be more specific?
I just said the onset of a female or hormone profile would be what induces these changes.
There are also hormonal triggers involved.
But it allows people to be capable of reproduction, correct?
I mean, typically, yes.
Not always.
Yeah.
Not
people
always.
aren't fertile.
Typically, correct?
Maybe.
It allows boys to have mature sperm and girls to have mature eggs, right? That are ready for fertilization.
There's just a lot more involved.
Yeah.
Than that. It's not just that.
But all you guys said was it's changes in your body. We can go through changes in our body through getting chemotherapy, just getting older, getting into an accident. You have to specify. So when you say puberty, that word means something specific. It literally means capable of reproduction. That's what it is.
Well,
no, but I did tell you what it is. Sorry.
Even we could just go to literally, there's a lot of sources that wouldn't say that it necessarily has to include things such as becoming sexually mature.
So what would it be?
It's more of it's physical and hormonal changes that mark a transition into adulthood. That does not necessarily mean that they're becoming sexually mature.
But what is that for?
Why
is that happening?
Because of hormonal changes.
So that our bodies can function well? Yeah. I don't know.
So you just think puberty is hormones being released so our body can function well?
Well, hormones, they
part of it, but the definition Keaton gave is much better.
Yeah, so it's...
Go ahead.
It's a part of development. We can all agree about that, right?
Yes, but what is the part of the development?
I don't know what you're asking there.
You're making you're just painting. I feel like you're slapping paint on a wall, and you're like, well, I finished the wall.
Like if we're talking about cisgender individuals, yeah, generally it's going to be talking about them reaching sexual maturity, but that's an overly broad.
What was the definition you gave earlier, Keaton, where you talked about entering into adulthood? That I thought that was pretty good.
It's not entering into adulthood. It's sexual maturity.
Well,
it's the start for girls. When you're saying that a male can go through female puberty, can you acknowledge at least that the female puberty would be starting menstruation?
Not always.
Do all women go through menstruation?
No.
Okay.
That's why I said typically. That's why I said typically. Typically, it's the start of menstruation for girls, and males typically produce healthy sperm, or just fertile sperm. Typically,
I'm gonna say typically no, just because that's not fully encompassing of what puberty all is. Like, yes, you're not wrong, but there's a lot more involved.
So, host, can I just ask a question? The people in the comments, I think they're finding it hard to read the chat and things. Are we able to like
Yeah,
maybe change the layout?
I
Would
can
that be all
maybe
right?
do. Oh yeah, I could change the layout too. That would be another way to do it.
I think this is a good time for a little mod break too. If you enjoy the conversations, tap the screen, send the live to your friends if you think they'd enjoy watching as well, either today or another day. We typically do have like different guests throughout the live, but today we're debating Christie and Envy. And then what was the other thing I was gonna say? Oh yeah. Be respectful in the comments or you will get muted. If you tell anyone on the panel to drop their attitude, you're gonna get muted. Like, and if you keep asking, like, why did you mute this person? You're probably gonna get muted. So just be respectful,
Take that
mind
as
your
a
business,
call.
and
see, that's why I
let
do.
it
That's why
be.
I like to hold these on my panel, because I don't mute anybody. I have people that threaten my life in my comments, and I let them threaten.
Well,
Good
I would
for
just
you.
take
That's
that
not how
as
we roll.
I'm just saying. I
Cole,
mean,
if I
yeah.
could just say respectfully, I mean, I understand if somebody was, if someone's attacking you or insulting, I can completely understand that. But if, you know, this is what the viewers are here for. I mean, I've had people in the comments say things about me. I didn't see any of you guys muting them. So why is it one rule for you? And then when I get spoken about in the comments, nothing happens. So if we're going to do that, then you have to apply it across
Yeah.
the board if you're going to have a space like that. So if you could just unmute Nick then, and then if you're going to do that, please,
No,
you know,
rather than unmuting somebody that I've already muted for something, I would encourage you to tag me in comments that are disrespectful towards you in any way, because I'd rather mute more people than start unmuting people that have already shown
what
me
my,
disrespect.
yeah,
I'm
I
not doing that.
understand that. But I think what my point is, you're very quick to pick up on people saying anything about you, but when something's being said about me or Christy, you magically don't see it. I think like your moderators, and I appreciate the apology in the comments, your moderators, to keep their eye on the ball as well, and let's all treat each other fairly. We're not here to, you know.
I would just please ask if anybody is abusing me in the comments, to not mute them. Is that okay?
Fair. If
Yeah,
the host is okay with that, that's fair.
Any negative things that are said about me in the comments, please leave them. I
I'm fine with
actually
it as
like
well.
it. I like it. I'm a
I'm fine
weirdo.
with it as well, Cole. The only reason I
Oh,
had brought
so
it
now
up.
you want the opposite. Okay, cool.
No,
It's
no,
okay.
it's
It's
not
fine.
wanting. No, no. My stance is I don't have an issue with it. I can go anywhere. People can say what they want. I genuinely don't care. But what I'm saying is, if you're going to hold that standard for yourself as a co-host in this live, then you must, on your own back, hold that same energy for your guests in your panel. But what I'm saying is, I'm okay with it.
So, okay, it's good to know for both of you now for the future, especially, but also for anybody who's ever on our lives or ever in the chat. If I am not catching things that aren't about me or the host, if I am, if someone's being rude to somebody else in the comments, you just literally tag me in it. So that I can go back and see it, and then if I can confirm that. And the reason I'm asking for help, because I know you said I should carry it on my own back as a co-host, is because I'm disabled. I'm one person. There are a lot of comments coming through today. We're not used to having almost 300 people in our lives. So there are certain things that I'm not going to catch. Most of the time, I can't even listen and read comments at the same time, like 90% plus percent of the time. So I'm doing my best, and if people help me, then we can keep it a safe space for sure.
All right, let me just tell my husband to be quiet because he's being loud. Hold on.
So are we still on the puberty blocker thing, or are we moving on when Christy gets back? Or
well, I still don't think that the point's been made that like I made the claim that the puberty blockers don't make your bone density go down, and that It doesn't really.
Right.
BMAT
Okay. And
scores,
your own. Sorry.
BMAT scores, the Z scores don't matter at all because it's you're comparing people who have gone through puberty versus those who haven't. So of course they're going to be different, and that like it's okay for people to have slightly lower bone density for a while if it's going to just shoot back up after the fact.
Again, your study didn't demonstrate that, Christie. Like read it out from your own study, and so did like there is a
How does it not?
decrease because we read it out 2 to 3 years. It decreases. Where did it say that it shoots right back up? Because what happens after the puberty blockers is the cross-sex hormones, right, which also contributes to that fact. So your
Yeah, and
own
there's
study is showing you that.
the other graph that looks at for the 3-year let's see, I have to swap it over. You can see that a lot of the for the let's see, lower spine, the BMAT's LS scores are going up, and the Z scores get up to more normal levels. Sometimes even better. So this is for people who are both on puberty blockers and gender affirming hormones.
I have a theory as to why it's actually better, and that is because trans women are going to have their hormones checked typically every 3 months, and then they can change the dosage, but dependent on what their estrogen levels are. So later in life, when cis women go through menopause and they have more increased risk of osteoporosis, and then they start taking HRT to help with that. Trans women aren't going to have to do that. They're not going to have to find a point halfway through their life to start monitoring things to make sure when it starts going down that they're supplementing. They just already are checking their hormones often.
Yeah.
And
Yeah, for that purpose.
I'm going to finish. Okay. They're already checking their hormones consistently and keeping them within normal ranges. Especially if you're comparing these trans women with their cis women counterparts, you would see actually typically, possibly, better bone health in these people than you would in cis women.
Okay, but the reason why they're checking it is to see if there is a decrease. Now, the study that I was sent, I can't actually see that graph. So can I don't know, can someone send me that? I'd like to see the study with that graph in it because I'd like to understand it a little bit better if possible. Are just seeing that we're just disrupting a natural development. Puberty is not a disease that needs to be medically treated. It's a natural development to have a healthy body. So can I get that graph or the study for that, please?
And also, Charlie just said in the comment, I was going to ask you, how do you know that it's better than female levels? It doesn't show that at all.
I literally said I have a theory and a guess because Keaton just showed where it actually is better sometimes. And I said I have a theory and a guess as to why. So I did not say that this is scientifically backed. I did not say that there's just been research on this. I did not say anything except this is why I suspect that in that graph right there that Keaton's showing, that sometimes the BMAT is actually above average a little bit and a little better.
So can you unblock Vonnie? Why did Vonnie get blocked?
Because
these are our supporters have come in. I didn't see Vonnie write anything thing on the. Can we not?
I can tell you, I don't want to have to be doing this the entire live though, because that's not the topic of the live. But I'll let you know. So Vonnie said, I have disabilities too, and I can mod my own lives just fine. Don't use that as an excuse. And that was ableist. And I said, please don't be ableist or you will be muted. And she said that she wasn't being ableist and that I shouldn't be using it as a quote unquote excuse. So I muted her because she was being ableist towards different disabilities than she has. She doesn't even know what my disabilities are, so how the fuck would she be able to know whether they affect my abilities to mod or not?
But I just find it amazing how you see all the other comments. They're just crazy to me.
I don't see most of
right,
them.
okay, I'm sorry.
Literally, I told you this.
Okay.
So I just want to go back to what you said. You said you have a theory.
Well,
Can you tell me
I'll just be blatant with this. This is just comparing the z-scores, and it's above. The z-score is positive. That means it's better.
No, it doesn't show. It doesn't.
Well, that's what
it doesn't
z-scores
even,
are. That it's comparing
yes.
against the general population. It means that on average, these people have better bone density.
But you're taking a male and saying that. Okay, why would a male have better bone density?
This would be a female. In this
Use
case.
that chart. Use that
This
chart.
is a female. This females start with lower bone density than their peers, and then it gets to better bone density than their peers because they've been on testosterone. That makes perfect sense.
No, it doesn't.
That testosterone would make
No,
your
it doesn't.
bone density increase?
It
No
does.
way.
It's wait. Hold on a second. Wait. Let me. I have your study up. I have your thing up. Hold on a second. Go ahead. You can finish. Let me just get my thoughts together because what you're saying is it's not correct. A girl on testosterone wouldn't have better bone density than a girl with normal hormone levels. Female hormone levels, right? Estrogen with a little bit of testosterone. You're saying that a quote trans girl on testosterone would have better bone density than a girl that's not on testosterone?
Well, it wouldn't be a trans girl because it would be a trans boy at that point.
I'm sorry, a boy. You're saying wait, restate it and just use the words boy and girl so I could just say it again.
So females who are on testosterone are going to have a giant bump in their bone mineral density because they're entering essentially, they're going to have their bones develop similar in a way to what a male would when they enter puberty. Therefore, it's going to be, and I think it's generally accepted that males would have, that we have stronger bones than females typically, especially when they might be similar before puberty, but they're going to jump ahead after puberty. So testosterone is going to help you out in that sense. And it brings up, the study brings up the question of like which sex we should be comparing these people to. Doesn't go too much in depth into it, and that's one of the criticisms I have of this study, is that it doesn't actually look at it too much, but it is, I think, an area that it should be investigated of.
So from my understanding, girls that take testosterone will have their bone density will exceed typical female ranges. You're right. Yep. However, it will change biomechanics. It will affect their joint stress, ligament flexibility, and or fracture patterns in ways the body isn't evolutionarily adapted for. And then high testosterone in females will suppress estrogen levels, which could impact spine health or other estrogen sensitive tissues if not carefully monitored. Okay.
Well, this is literally
higher
talking
than
about
female
the lower
range
spine here.
Well, what?
This graph literally is talking about the lower spine, so it is showing that these are better. So, but yeah.
Right, but it from what I'm reading, it says testosterone will build cortical bone, like hip shaft of long bones, more than trabecular bone, like the spine, which may create uneven bone strength and growth, possibly affecting fracture risk patterns.
Yeah, there's
so
going
yeah,
to be risk
so their bones will be denser. Their bones will be denser, but it also comes with other side effects. Does that make sense?
Well, yeah, I'm assuming that just even in general, puberty has side effects of potentially causing other sorts of new fractures because bones change shape.
Right, but you're making it seem like it's better for a girl to be on testosterone because their bone density gets stronger or it gets thicker or whatever language you want to use.
We would never claim that girls should be on testosterone.
Yeah,
trans boys and men should be, to be clear. Also, one of the commenters said, and this is why they carefully monitor hormone therapy.
Right, but are they doing bone scans every 6 months on you guys?
It can be carefully monitored in other ways.
How can you monitor bone density?
Yeah,
other than with scans.
Well,
I know
you're also
they're
gonna.
not doing scans every 6 months, 3 months. There's no way. How would you measure? How would you find it to make
Can
sure?
you let me answer your question? Because it's like the third time you've asked it, and I did hear you the first time.
Okay.
You can check vitamin levels like calcium and such within people to determine what their bone density is as well. So it's the blood draws that they're able to extrapolate this information from for the most part. Scans aren't necessarily something they're going to be exposing patients to frequently. There's just no need to. They can extrapolate enough information from the blood draws. But if there was concerns, obviously we'd have access to that kind of thing as well.
From my understanding, the best way to do it would be a scan, a DEXA scan.
Maybe the best, but not the only way.
The most accurate way to measure bone density would be a DEXA scan, DEXA.
Sure, but it's not the only way.
It says you could do you do blood work, but it would only measure. It says it measures the bone separately, can detect early loss. High radiation, less widely available. Ultrasound, less precise, not standard diagnosis. Bone turnover markers, blood and urine doesn't measure actual density. It says it here. So it says,
You can extrapolate the density from the results. So that's what I've been saying. You take the information from the blood draw, and you're able to extrapolate what bone health is.
Okay, it says bone turnover markers, blood and urine. It doesn't measure actual density. It literally says that it doesn't measure it from blood work. You'd have to do a DEXA scan.
So it might not measure directly, but you can correlate the data. That's what I think.
I would just say no on that because I'm literally reading that it says it doesn't measure the density.
I mean, it's talking about how you can do blood draws and how even though it doesn't directly measure density, you can extrapolate that from levels that are pulled in these blood draws consistently every 3 months.
When a car slams on its brakes
not,
and it leaves skid marks behind, that doesn't measure the speed, but from the length of skid marks, you can extrapolate the speed that they were going.
Exactly.
There's correlation between the two.
Okay. So it says DEXA measures bone density directly. It tells you the actual bone health and fracture risk. Blood work measures bone metabolism. It's useful for trends, but cannot replace DEXA. So it's not even, they're saying it's not even usable to check for density. I mean, we could just move on just for the sake of the conversation.
Well, they didn't say it wasn't usable. They said that it's not as, it doesn't measure bone density and DEXA does. It's not a replacement for DEXA. That doesn't mean that it's useless, that they don't use it.
I didn't say that they don't use it. I said it's not accurate.
It doesn't mean it's not accurate either. It just means it's not as informed as the bone scan would be.
I mean, but that's my point, right?
Yeah, I don't disagree with you on that. But with the blood work, you can still extrapolate bone health. That's my point.
Not from what I'm seeing here. It does not predict changes in bone structure. It does not fully reflect bone strength or density that DEXA measures. So
I'm not claiming it can do what DEXA can do. I'm claiming that doctors over literal decades at this point, I'm sure, have been able to correlate certain blood results with bone health over time by using things like bone scans alongside blood work. And then they were able to say, oh, everybody with this bone density and this bone health has these blood work results every single time or near every single time. So now we can just do the blood work and we don't necessarily need to rely on a full 100% scan that's going to cost more, that's going to expose somebody to more radiation. We can just extrapolate it from the blood work. So again, I'm not saying it's the same. No doctor would say it's the same, but it is still useful for sure.
I would just disagree.
Why you would even?
I would just disagree based on what I'm reading. Not even remotely in the same fields.
I mean, we're not talking about bones being super fragile. There's no evidence to indicate that these bones are getting more fragile. It's just that the bone mineral density is staying the same, and unless if somebody has concerns about it, I see no reason why we would have to be monitoring this. As long as it's properly communicated to people who are going on puberty blockers, I see no real reason and why we would say, oh, we must monitor these people more. That makes no sense. The bones are still strong.
No, because when the density decreases,
It doesn't decrease.
again, it heightens risk, right, of fractures and osteoporosis. This is the whole point of it. That's why it has to be checked. We
But
can't
it's
say
literally
to
not
someone,
decreasing.
we've
been over this.
It is.
The
The
Z-scores
study
are.
shows that it does.
No, we've been over this. The Z-scores are showing a decrease, but the Z-scores don't matter. They're not measuring like, point,
They
person
do
A's.
matter because, all right, so it's like me saying, right, if somebody like if we change this to like weight, right, we have a healthy weight range that typically being like for my height, I'm supposed to for 5'4", 63 kg is anywhere between, sorry, I think 59 and 63 kg is a healthy range, or 58. But then when you got someone at my height goes below, say 52, 51, 49, 48, 46, that then puts you in an unhealthy range, right? So yes, you do need it. You do, because I can't turn around and say, right, I go to the doctor, I'm having a eating issue, I'm having a distress of my body because I've got a fast metabolism or something like that, and I'm in an unhealthy. No, we can't even say I'm in an unhealthy weight range because we don't know what the healthy weight range is. So when I'm trying to put the weight on, how do I understand what range I want to put my body fat into to then be healthy? Because when you are having, when you're at an unhealthy weight range, if you're, for example, underweight, there is vitamin deficiencies, malnutrition, it can affect your periods, things like that, and the same vice versa, right? So we need to understand what the healthy ranges are. So when we go to the doctors and I say, and they weigh me, they can say, you're 46 kg, that is unhealthy. So we're going to prescribe you or give you this or encourage you to eat small and often, add extra calories into your diet to then increase it to put you in a healthy range. This works everywhere, even with your IgG levels, IgA, IgM. There are healthy, like for example, my IgG has fallen out of the healthy range. Now my body does not produce antibodies. So if I catch a sickness, my body doesn't produce the antibodies to fight it because I'm not in the healthy range. So then the treatment for that at some point would be blood transfusions. They can't just turn around and give me a blood transfusion if they don't know what the ranges are. This is insanity.
So what's insane here is that you're not catching the point that what we're talking about here is somebody who stays the same height and same weight and just stays there. And then you're comparing them against people who are gaining weight and gaining height and say, oh, this is unhealthy all of a sudden.
Because there are side effects and health conditions that come along with it. That's how it's identified, right?
But if they're healthy
so the fact
at
that
weight,
my IgG, oh sorry,
if they're healthy at the height and weight, what does it matter?
What do you mean?
So we're talking about like if these people people are going to be healthy generally, and their bone mineral density is just going to remain the same, and they're generally not going to grow much.
No, because the cross-sex hormones or the puberty blockers is going to start decreasing that within their body. So they could be eating.
Not what we see.
Okay, I'm not trying to correlate in the sense of like, oh, you have to have a healthy. Well, I'm using it. It's an analogy. I'm using an analogy here. So if I'm going for a specific reason, and the doctor does my check on my weight, because everyone who goes to the doctors, I don't know how it is in America, but they tell you to jump on the scales to check your weight. I've got to get mum's home from the hospital. I'll be back.
Yeah, it's just talking about stagnation, not decrease. That's the problem here.
Yeah, really quickly, a side note for Christie, there is somebody that was threatening you that I did mute because a commenter was bringing up
it.
other.
No,
listen,
I like it.
Listen, a commenter was bringing up how they were being racist and giving threats, and if other commenters are also uncomfortable, then I will mute people. And it's been few, but when it comes up and other commenters are uncomfortable with it, I'm gonna respect everybody here. Okay.
Okay.
And it's all recorded, so you should be able to go back and look for whatever if you want.
Okay. I just don't. I literally don't care when they do that. It doesn't bother me. But I understand you guys live. You do what you want. I don't care.
I just wanted to let you know because I know you requested it that I don't, is all.
Okay, that's fine. Let me see something. I also found a source that let me see. They used a they're showing the BMAD levels dropped without using Z-scores.
Can you link me that?
Yeah, let me see. It's a significant decrease in absolute BMAD levels over that time in both trans boys and trans girls. Let me see. 46 adolescents. Okay. Here, 1 second. Give me 1 second. Sorry for the background noise. My house is all up.
It happens. I don't care that much. It's not like it's super loud either, so.
We've already been live for like an hour and a half. I just realized that.
Yeah.
Sorry. I actually have to grab something for work, but I'll be back in like a minute.
Okay.
Okay, that's fine. Hold on, I got this study here.
I'm gonna go refill my water bottle real quick too, so I'll be back in a minute.
Well, all right. I'll send the study to you. Let me see. Let me get the thing. 1 second. Endocrine system. Here it is. All right. Let me see. Oh my God, my phone's going crazy. Oh my God, I feel alone up here. Let me see. Okay, it's right here. I think this is it. Copy. 1 second. One sec. We're all here. Is there like a lot of background noise? Do you guys hear? My husband and kids. Oh jeez. Whatever.
We can hear them. If it gets worse, we'll let you know if it like bothers anyone who's like especially neurodivergent
I'm
folks.
sending the study over here. They in the study they show Z-scores and not Z-scores. I sent it to Stotsky. They could see it.
Yeah, he's the one with. I have notes. They're actually paper though. He's the one with the computer, so he'll be able to pull that up when he gets back.
Okay. Wait, are you a trans? What are you? Are you
What
trans
are
man?
you?
What are you?
I'm a person who uses
I
they
am
them
too.
pronouns.
What pronouns?
They them pronouns.
Are you female or male?
I don't see why it matters.
No, I'm just asking.
Why do you care?
I don't
Christie, seriously,
prefer
why do
to
you care?
disclose in this
I mean,
moment.
I don't specifically care. I was just asking.
Well,
If you don't want
then
to
you should.
disclose, it's fine. I could just
Yeah.
I'll make an assumption. It's okay. I was just asking, so I didn't have to
Why
make an
would you
assumption.
assume that?
As long as you respect my pronouns, then I don't really care.
Well, I don't think I needed to refer to your pronouns in this live whatsoever, actually. Right?
Well, for you, I'm just saying if you ever do, that's all.
Okay. I sent the study to. I'm about to say I sent the pronoun.
Oh,
I sent the study to
I see
Stoat.
it.
Yeah.
I will copy.
Yeah,
it
I know.
quickly
I'm
to
just.
the-
I'll make my own assumption. We love the they thems. We love them.
Keep saying I'm a man on HRT on estrogen or that I'm a woman on testosterone, and you will get muted.
Why? Why does that
Because
bother
it's
you?
extremely fucking disrespectful to just try to assert things about somebody that you don't even know. I'm a stranger on the internet, Christy. People should not be treating strangers on the internet this way.
They literally said that I should be hanging out with my children today and that I should be in the cast of Wicked.
And you told me to leave it, so I did.
I know. You shouldn't let people have to say about you, like, even affect your life at all. There's such a big world.
It doesn't like affect me, but I do try to keep the space respectful. Generally, I don't want this happening to other queer folks in our chat. And if they're doing it to me, they're probably doing it to other people. So I'm gonna mute them
This
personally.
one just also doesn't say what you think it says.
Oh, sure. Anywhere.
I'll just send you the quote. Although there was a significant fall in lumbar and hip and lumbar spine BMAD and lumbar spine BMAD Z scores, there's no significant change in the absolute values of hip or spine BMD or lumbar spine BMADs after 1 year on G and H rays.
I just said they use Z scores, and they also don't use Z scores only in the study. That was my point.
Yeah, but it says there's no significant fall in the non-Z scores. There's no significant change in the absolute value of hip or spine BMD or lumbar spine BMAD after 1 year on puberty blockers.
Bone mineral parent density scores decreased significantly in both trans boys and trans girls, while BM80 FN Z scores decreased only in trans boys. Fat and fat mass index Z scores significantly increased in both groups, while lean mass index Z scores significantly decreased.
Hey, where are you?
It says it.
I'm just gonna double check. I am looking at the same.
Sorry, I just got back. But one of my supporters again was muted. Can we unmute Little Red?
Well,
and Chrissy, this is why, babe, I want to do the co-hosting.
I'm just not going to.
This is why I want to do co-host next
disrespecting
time.
Us. I'll just be
honest. Okay, what did she say?
I have a community who is threatened violently, has worse outcomes in life generally because of this.
Yeah.
And I'm not going to let people spread hatred or misinformation. It's as simple as that.
Wait.
Right, so can we just switch to a co-host then, so I can have my people in my life so they're able to comment? Because this is what the heck? No one's threatening anyone here. No, I'm not leaving nowhere. I ain't running from this debate. But this is some pussy-ass behavior.
You can think whatever you want of it. It's just
not
I will
think
what
I want of it.
I have people that I care about in my life that it seems that nobody else does. And you know what?
Yeah, and I have people in my life that I care about. What's your point?
Yours aren't, systematically hunted down by people.
Dude, stop saying
that. There's a femicide going on,
it's not even true. You guys are not hunted down. This is not like deer season. Stop saying that.
Do you know the rates?
Have you looked at the rates of school shootings,
the rates of assault?
Transgender people? They're literally targeted.
Have you seen a femicide? Have you seen the femicide that's going on? Have you seen what's happening in Sudan to women?
I understand what's happening in Sudan and in the Congo, and it's fucking horrible.
Even in the UK, how many women are unalived globally? How many women
does not
die
take
in
away from the fact that transgender individuals are selectively targeted.
Victim-ass mentality, bro.
No, you're not.
Woe is me.
They are.
You're not You're not. Listen, if you look at the unaliving rates and what's going on in femicide, if you look at hold on. If you look at Congo, if you look at Yemen,
individuals targeted in school shootings.
What?
Yes, they are.
You guys are the school pew-pewers.
Absolutely not.
No, in the last 10 years, there have only been five school shootings in the last 10 years in this country have been committed by trans folks. 5 out of how many thousands of shootings in 10 years? Misinformation will be interrupted and corrected. That is insane.
LGBTQ people are more than twice as likely to be a victim of gun violence than their cisgender and straight peers. Twice as likely. Twice as likely.
Show the statistics on that.
Yes, I linked Christie, the source of where I got it from, and it can. I mean, I can find the actual.
Well, not the stuttering.
It's going to be the National Archive of Criminal Justice Data. is where it's citing it from.
You sent me a thing, an opinion piece called from Sandy Hook Promise.
Yeah, and I'll send you the link of where they get their statistics from. That's not opinion, that's fact.
You guys, why do you guys always use more likely? Can you give me a source to show me the unaliving of T people?
The numbers.
Give me the
Who
whole,
gives
the
a
raw
fuck
number.
about the numbers? It's the rates that matter.
What do you mean? Who gives a shit about the numbers?
You made the claim that you guys
weird,
if
bro.
you made the claim that you guys are being hunted like deer. I need to see how many of you guys are actually hunted.
It doesn't matter about the number, it matters
Of
about
course
the
it
rates.
No, it doesn't
Why does
matter.
the number give
Listen,
matter
What are
at
the
all?
numbers? No.
we're saying, I could say, you're 5 times more likely to get into a car accident if you drive drunk. I want to see how many car accidents actually happen. That's what I'm asking you to provide. And you guys keep providing me these sources that's saying more likely, more likely.
So
You have more violence again.
When
You guys
there's a
think- you guys also
transgender,
think-
when there's a smaller group of people, there's going to be less of them total that are going to be unalived. Agreed?
That's not how per capita works, my friend.
What is per capita? That's what rates
head.
are. That
Per
is what
capita
rates
means,
are.
Per capita means per head. So what they do is they take the entire population of this dynamic, and then they see how many people in this dynamic are doing X, Y, and Z, and then they give a percentage. That's
Yes.
what per capita means.
Yeah, and so the
what
per
he's
capita
been
numbers are
advocating
higher.
for since the
That's the
start.
problem.
No. You showed me a source that says they're more likely. I'm asking you to show me how many are actually victims.
What does it matter about the? So actually,
Because
this
you made the claim. I'm asking you for the final. I want to see the final end results. You made a claim that they are
The
hunted, and I'm
rates
asking
for
you.
that.
You're saying that they're hunted, and I'm asking you to show me the,
yeah,
the
so
numbers.
the rates per thousand people are the highest, pretty much, of any group.
Can you show me how many are actually hunted?
Why does it matter how many when it's the rates that matter? Because you're
So I'm
talking
just going to
about.
decline. I'm just going to decline using your more likely source because you guys, there's also sources that show misgendering is a hate crime.
You just advocated for per capita, and we're talking about the rates, which is the same fucking thing. And then you're saying, show me the exact number.
Send me
You
the source.
advocated for per capita.
Send me the
So
source.
that's what we're talking about.
Oh, just send me the source.
Did you already? So,
Yeah, I gave him a source that talks about the rates.
and you just don't want to listen to that one?
No, I'm opening it now.
Okay.
Yeah, it's sexual and gender minorities experience higher rates of criminal victimization and
No. I don't want to see. I don't want to see.
counterparts.
No. I don't want to see people that are GAY. I want to see trans people. Your claim is trans people that you're hunted.
I'm pretty
I don't
sure
care
it
about.
does
You're
include
talking
trans
about
in
gay
there.
people. Tell me about the trans community, not gay people.
You want to separate the LGBTQ plus community into
Well,
these
I
little
mean,
groups?
if I ask you, give me the number of intersex individuals that are X, Y, and Z. Can I not pull that source out of that entire rainbow alphabet and ask you for a number for
Yeah,
that?
but
for
when
that
it
dynamic?
comes to the way we're treated, it's something that we generally look at as a whole, because we're as a whole experiencing these high rates as the LGBTQ plus community, not just as one group or the other.
Well, I'm asking you to pull out the numbers for trans people. Because hunted is a bold ass word to use when you're talking about people looking to
Well, when the
unalive
rates
you,
are
but you're being
twice,
hunted.
so when the rates of people being unalived by guns are twice as high as their peers, do you not consider that hunted?
Show me.
Oh, so
show me
if
the, show me the T. Wait, no.
unalived
Show
your
me the
kids
T.
at
I'm
twice
asking
the
you to
rate,
show me
would
the
you
T.
say I'm
the
hunting
T
them?
numbers.
No.
I'm asking you to show me the T numbers.
If I hunted your kids at twice the rate of everybody else, would you say that's twice as that I'm hunting them? Because I damn
Hunting
sure
at
think
twice
that you
the
would
rate?
be.
I'm asking you to show me how many actually went through, how many lost their life. Is that clear?
It does not matter the number. It matters that people are being targeted.
If I say to you, 50,000 people are
Do you
being
think
targeted.
that one person losing their life means any different than a million? Every
me just finish
single
my-
person is valid and matters. And if
Yes,
you don't
I-
think so,
my-
you can get the fuck out of here.
That's not what I said.
I'm not the crying.
Nobody made that claim.
Well, then why does the number matter?
I don't
If you're gonna laugh
You
at
made the-
people
you made the-
valuing
Why
human
does the
life,
number
if you're
matter
gonna laugh
if
at that, shut the fuck up.
You made the argument, not me.
yes
You
that
said
the rates are twice as high? Damn right they are.
Damn
And I'm asking you to show me the end result numbers. That's like me saying 1 million people have X, Y, and Z, but 4 people lose their life. If I say to you 1 million people have this disease called blippity bloop, and 3 people unalived from it. I want to know how many people. I don't know why you're getting angry. I'm asking you to
In
provide.
2023, there's at least 35 homicides. In 2024, at least 32 that were just
30.
Listen, Christie. This is why you were advocating
listen,
for per
Linda.
capita. Listen.
This is why per capita matters. Because there's
32.
This is why rates matter. This is why we're talking about rates. Is because if it's 32 out of 100 people, if it's
Well, you didn't say out of
rather
a-
than
you didn't say out of 100.
3,000 out of 10,000,
there are
those
only
rates.
3,500 kids
Like-
murdered
Hold on
in
a
the
second.
US.
Wait, stop.
Oh,
Send
wait.
me. Send me
They make
what
up
you
a
just. I'm
huge
gonna show
more
you how you're
population.
wrong.
Percent of the
I'm
population.
gonna show you how you're wrong. Send me what you just sent to me.
Listen to the host because he's explaining right now.
Okay, go ahead.
So, if like, it does not matter that it's 32 people because of the fact that they were a smaller population.
My question is, can you send me that source? And I'm going to tell you why what you're saying is wrong.
Yeah,
What's the source that you have?
If you're gonna compare it to the homicides of non-trans folks, then that would be. I'm just saying if. So that's
Is
good.
that a study from the United? Is that from the United States? That they're saying that they're unalived, or is that global?
I think that's just in the U.S.
Okay. Okay, hold on.
Send it to me.
Still 2 times the rate of cis people.
Okay, hold on. Let's see.
So here's one of the sources. That's saying at least that gives one of the numbers.
Someone mentioned Statista as well.
Yeah, that
Okay,
probably is going to be. Are you not? Do you not think that they get killed at higher rates? Because they absolutely
Hold on a
are.
second. Hold on a second. Let me see. Oh, let's see. Okay, I got that number. Let me get the other number. Hold on. Stay with me. Stay with me.
Also, while you guys are looking at stuff, is it possible that we could, because at this rate, we're only going to be able to discuss the one topic today, can we come back another time for the other topic?
Yeah,
Yes.
but we're going to co-host it. We're not doing it in your live.
Okay, that's fine.
Yeah, I don't care.
Yeah, I don't care.
I'm new to live as a whole, so I might still be figuring stuff out, but yeah, that's really fine by me.
Okay. I appreciate that.
Okay. So let me look at the numbers you just gave me. You said 32 in the United States of trans people. So there's 2.8 million trans people in the United States, approximately. 32 of 2.8 million trans people would be 0.001142857%. Okay, so 32 is about 0.0011% of how many trans people get unalived per capita in the United States. Now we'll look at men. In the United States, there were 19,800 homicide victims in the USA, and this is just men, by the way. So the male homicide victimization rate was 9.3 per 100,000. Let me break that. Hold on. Hold on, I gotta do some math for a second.
I've got work. I think I'm just gonna stay on mute while I do a few things. 20 minutes or so I'll be back, and I'll try my best to listen while I'm working as well.
Okay. So trans people are 0.0011, and men that are unalived in the United States are 0.0093.
Okay, but are you including that? Like, I was talking specifically about school shootings.
I'm using your entire trans men, males and females in my numbers
Okay, I'm talking about school shootings.
out of the 32.
which
And
have different motivations than, like, things such
Well,
as
that
gang
wasn't your
violence. Don't
The
you
claim
agree
was
that
that-
gang violence is going to heavily impact things such as motivations and rates? Yes, it's going to impact those things. But in school shootings, these things people who are transgender are targeted more often. than depicted.
Right. I think the claim was that it was
A larger number.
being hunted down.
Yes,
Hunted.
that is literally what
Yeah.
that means, is that they have higher rates. It means that they're actually targeted, correct? I don't think that twice as likely is just a, uh-oh.
But that what Christie just
Considering
read
that
out.
nearly
says other-
20% of all hate crimes are motivated by sexual orientation or gender identity basis.
Right, but what Christie just read out just kind of shows that that's not the case.
It's
Like,
literally not.
I mean,
it's
I
not
think we
the
can
case.
all agree that all unalivings, like, do you know what I mean? It shouldn't be happening at all to
Yeah, but
anyone,
when you-
right? We can all agree with that. But the claim to say that we're being hunted down, I think that's a little bit extreme.
I mean, we
you
do
know,
know that some of them have actually, had manifestos that said that, yes, they're actually targeting LGBTQIA+.
right? And yeah, and then
communities.
your little rainbow mentally unstable community
Whoa,
have also had manifestos.
Mentally
Yeah.
unstable?
Yes, mentally unstable. Yes.
And what do you think that is?
Because you guys deny biological reality and
No,
want to replace it with a
it's because
subjective.
society is the problem, not trans people.
Also,
And
it's
you
not
know
I
that?
think you guys, I mean, right, I understand there may be some contentions with social
You need to show
construction.
us it to us in the DSM. If you're going to claim something as a mental
Well, it
illness,
is in the
you need to show
it
to
is in the
What is
DSM-5,
it?
isn't it? Little weirdos.
Have you actually read it? What some of the logic behind the DSM-5's thing about gender dysphoria? It's absolutely horrific. Some of the things that are claimed in it are hilarious. They're studies from the 80s and 70s that were looking at one person who ended up unaliving themselves, and they say that this is a way of good treatment. It's crazy.
And last I checked,
I don't know what you're trying to prove here, but okay, I don't know how that
The
equates
DSM-5 was
to being
written
in
by
the denial.
the
bigots.
last
for the
thing
most
I'm
part.
trying to say, Advi, is that gender dysphoria is not being transgender. They are not the same thing.
Yeah, because not everyone who has gender dysphoria is gonna move on to cross-sex hormones and mutilate parts of their bodies and.
It's
You know what I
not
mean?
mutilation. Don't
Yeah.
use that word again.
Well, it is.
Well, so
It
let me
is,
just
isn't it?
put it
Because
this
when
way.
you for
If you're gonna
example,
use the word such as
if I
mutilation,
fall over,
if you're going to use the word
What?
such as mutilation, it just shows how bad faith you are.
no,
You don't actually care about what these people think. You don't care
no,
about
I
them.
absolutely do. That's why I'm using the correct language to address the situation. When we are using incorrect language for these types of situations, I would say it's
What
being
makes you the
ignorant
arbiter
to
of truth?
the
What makes
reality.
you the arbiter of truth?
Well, I'm
What
not
makes you the
claiming to
arbiter
be.
of truth?
I'm,
So
I'm,
then you
I'm,
can't
I'm
say
not,
that you're
I'm
using
not,
correct language.
Well, I am because when you
No, you
cut
can't. There's no
if somebody
objectivity in language.
yeah,
There's no objectivity in language, Envy.
removing body parts throughout history has always been a sign of humiliation
Appeal
and mutilation.
to
They
what
call it
history?
mutilating. They mutilated this woman's body.
I don't
they
think you want to
mutilated,
rely
and
on
it's
the
always
history,
the
Envy.
removal of the
We used to think that
genitalia
slavery
or
was
the
fine.
breast
It's clearly
or,
not.
or something like that. So the fact that it's just because it's done medically, it doesn't make it any different throughout history what mutilating people's body
Hey, Envy,
is doing.
Envy, don't you
So,
agree that,
yeah,
that throughout
yeah,
history we
yeah.
used to think that slavery was fine? Oh, holy shit!
What,
History's not a good place to
That's
get our
that's
morals
not
from.
analogous here.
It
No,
is.
I don't know.
Because
I'm
you're
not
appealing to
arguing.
history.
I'm not arguing for laws. We're simply speaking about
No, you're
terminology.
appealing to what
no,
history thinks.
no, I'm saying to you, this is what the word means.
Well, let's look at the definition of the word mutilation. It's the act of severely injuring, damaging, or disfiguring a body or a body or
But
an
it has
object, often in a
connotations with
violent
it,
or
agreed?
intentional way. So, would you say a woman getting their breasts removed is mutilation?
No, absolutely not, because it's in a medical setting. Do you think that people who go under double mastectomies
Exact-
are getting their breasts mutilated?
Okay, so I'll tell you this: when they were conducting experiments
Under
on-
that logic, my mom mutilated her breasts
Right.
to save her fucking life.
right, so
Are you saying that my mom mutilated her breasts to save her life?
no.
Oh, so mutilation
You have to
doesn't
take,
mean...
you have to take
No,
your
hold-
emotion.
No,
take your
come on,
emotion
come
out
on.
of the argument.
Fucking
Right,
lock in.
okay.
Does that mean my mom
I'm
mutilated her
locked
breasts?
in.
Did my mom mutilate her breasts?
Her
Yes or
body,
no?
the
Right,
body
I'm not
has
answering
been
these
harmed.
questions. Yes or
If I
no?
lose, if I
Last,
remove
you
my
have one
breast-
chance to answer,
Okay,
or I'm
I'm
kicking
trying,
you both. Yes or
Derek.
no?
Why are
I'm
you getting so upset?
trying, Derek.
Because
Relax.
you're saying
You're not locking in.
answer,
I'm pushing
Derek.
your morals to its
I'm
limit
locked
and
in.
showing that they're
You have
fucked.
to
Right.
calm down.
Right.
Literally, calm down.
Right.
You're getting so crazy.
Did my mom mutilate her
There
breast
are
when she got a
women-
double mastectomy to remove her breast because she had
And
fucking breast cancer?
Look, I don't
yes
really
or
want to
no?
speak about. Can
down.
I? All right. Can I answer? I don't really want to speak
Yes or
about
no?
your
Yes or
mother.
no? That's all I want to hear
I'm
out of your
not-
mouth.
I don't.
Yes or no? Lock in. Yes or no?
Woman is
Dude,
Yes or no?
stop-
I don't want to hear
stop strong-arm-
anything
stop
other than
strong-arming
yes
so
or
you can get
no.
out of the argument.
Yes
Stop
or no?
Stop strong-arming so you can get
Yes
out
or
of the
no?
argument.
Yes or no?
Same woman.
Learn how to have a discussion. Okay?
I'm asking a question. Yes or no?
I already answered you to calm down. You've been out of control this entire life. All the last 30 minutes, you're ridiculous. You made
Well,
a
you're
claim
implying
that
that my
you're being
mother
hunted.
is mutilating her
Hold on a
breasts.
second. Stop a second. Stop.
You're claiming that my mother
Stop
is
a second.
mutilating
You
her
made it-
breasts.
You made it.
You can't say that he's
Hold
been out of
on.
control
You made-
like
let me
this.
just finish
I just-
speaking.
No,
You made a
no, I
claim.
don't want
You
you to
made
speak
a
about
claim.
my
You're
friend
saying
like
that it's
this.
mutilation.
I don't want you to speak about my friend like this.
Nobody's speaking about your friend. I
You-
read a
you- you
definition.
made the
of it.
claim
You're
that
taking
it's
it as
mutilation.
a-
He's been out
Okay,
of
Christie.
control the entire life.
Okay,
And
you've been.
I will
I've been
the whole-
nothing
you've
but
been-
calm.
the last 20 minutes has been crazy. You said that you guys are hunted.
There's been passion
Okay,
because
that's
we
fine,
are
that's fine.
hunted,
Because, like,
and
Christie,
because you're
let-
saying
should
that
I
getting
care
a double
about people that are-
mastectomy
Let me
to
just
save someone's
finish.
life
Just finish.
is
Listen
not
to,
good care.
okay,
So
listen to what
just
I'm saying
don't
to you.
don't be disrespectful. Don't tell him
I
that he's
haven't
out of
been
control.
disrespectful
That's
to
all.
anybody on this
Don't tell
panel
him
at
that
all.
he's out of control.
I
Don't
haven't
tell
been
him that.
disrespectful at all. You guys made a
Don't
claim
tell
that
him
you were
that.
hunted. The numbers show that people that are not
I have
trans
to go back to work.
you made a claim that you're hunted. The source
I made
that
the claim
showed
that
you-
they're hunted in school shootings. Yes, I did. Agreed?
You said that they're hunted.
In school
People in the
shootings.
United States that are
In
not
school
trans
shootings.
lose. I heard you. People in the United States. You didn't say in school shootings. Now you're saying that. Now.
Well, I mean, if you look at the link I gave you, it is talking about gun violence.
Okay,
And-
but
and
you
the- and
didn't
the
you
thing
didn't say
it
that
says-
earlier.
It says LGBTQ are twice as likely to be a victim of gun violence than their cisgender and straight peers. This is talking about mass shootings.
You were talking about in general.
This
So
is
when I
talking
compare
about
the numbers, it
what do you think that
shows.
Samuel
Let me
Promise
just
is
let
looking
me
at?
let me
School
get
shootings
my
or just
sentence
gun
out.
violence in general?
Let me get my sentence out. You said that they're hunted. The numbers show that people that are not trans are unalived way higher rates by the numbers on the Census Bureau. So that was
29%
a
of
lie.
transgender youth have been threatened or injured with a weapon on school property.
Hold on a
compared to
second. You think that
7%
other
of
my
cisgender
friend's
youth.
son? Wait a second. My friend's son was threatened on school property
That's
with a knife.
anecdotal evidence. Anecdotal
I'm
evidence
just
is
saying,
only
you think that
evidence
trans-
of the anecdote itself.
Okay,
It
what
is
was your
not
claim
evidence
again?
of
What was your claim again?
what that transgender
What did you just
people
say again?
are. What did I just say? Notably, 29% of transgender youth have been threatened or injured with a weapon on school property, compared to
Okay,
7%
show me
of
that source,
cisgender
and I
youth.
could probably find you a source that has the same number or higher of other children that have been threatened in school.
That's fun. This is a CD fucking C who's giving that.
I'm just saying, you guys they're on par with other people. You're on par with other people. I don't know why you're sitting here saying you're hunted. It's not true. You guys are using this as a scare tactic to make people feel sorry
why
for your
are
community.
1 in 3 transgender individuals being threatened or attacked with a weapon at school then, if they're not being hunted?
That's not being hunted, first of all.
Oh,
Okay.
so what does being hunted mean?
Why don't you look it up
To be
and then
targeted?
tell us what
Hunted.
that means, being hunted, so I could scream and yell at you.
Yeah, to be hunted is to be like sought out, right? And
Being pursued
then-
or searched for.
Hold on. All right, look. Shall we take a minute, Derek?
Take a minute.
Should we take a minute here?
Well, I gave you a definition. Do you not like it?
Okay, no.
Lock in.
Hold on. I think we just need to pull it back a little bit.
We're locked. I can't be any more
We
locked.
can pull
I'm
back a
locked.
little bit once you answer
I'm as
whether or
locked
not my
as I
mom
can
has
be.
mutilated her breasts, Envy.
Right.
Relax yourself. okay?
I don't want to. I don't want to speak about your mother, Derek.
Derek? My name's Keaton, if you want my name.
Keegan.
Keaton, like Michael Keaton, but it's my first name now instead of my last. So did my mom mutilate her breast because she had breast cancer?
I don't want to. You know what? I don't.
Yeah,
want
I
to
grant that
speak
you
about
really.
your mother.
I'm
don't.
sorry,
I
but
do
you know,
not.
I'm
not.
concerned
Listen,
that they don't want. You know, I'm
Key, I
concerned
don't
that
want
it might
to
appear that
speak
you don't want
about
to answer
your
the question.
mother. I do not want to speak about your mother. So if we could
Why is
please
that?
just move
Why is
on
that?
because she's your mother.
So does a
I
woman
don't want
mutilate
to
her?
do that.
So
I wouldn't. I understand.
Remove my mother
my
from
mother's
it.
also sick. I don't. I don't feel comfortable speaking about your mother.
Okay,
Christie.
so we can talk about males with
Right.
gynecomastia. Do males with gynecomastia mutilate their breasts when they have them removed?
Right, because
They don't have their
okay.
breasts removed. They only have the fat tissue that lays underneath the nipple removed.
Well, that's what, my mom had done too. It was breast tissue
She had the
as
fat
well.
tissue underneath her nipple removed.
She had breast tissue and breast, like, muscle, the whole, like, whatever.
Wait, you said that she had a double. You said she had a double mastectomy.
Yes. I'm not
Double mastectomy is the actual removal of the entire breast tissue, the whole entire
Okay,
breast.
what's the difference? So is gynecomastia also not mutilation?
Wait a second. You're jumping all over the
is
place.
still also
No.
mutilation
You're jumping all
underneath
over the place.
your definition.
Stop. You just said your mother had double mastectomy.
Yes, she
Had
did.
double mastectomy.
She had breast
Now
cancer.
you're saying that your mother had the same thing as gynecomastic surgery, which would be the removal of the tissue underneath
It was a
the
double
nipple.
mastectomy. That's what it was. I thought that
You're saying that it's like saying that you got your foot cut off and then you got your entire leg cut off from your hip. Which one are you talking about?
So my mom had a double mastectomy. I didn't know that gynecomastia surgery was different. And my
Just to be
apologies if
clear,
I
a
didn't.
double mastectomy is both breasts removed. You just said
Yes.
she had tissue removed.
Well, I mean, breast involved tissue, correct?
No.
It was a double mastectomy.
No.
It was a double mastectomy.
Okay, she got her entire breast removed. She was
Yes.
flat like a board, and then she
Yes,
had to go
and then
back
she-
and get implants
Yes,
put in.
and get reconstruction. Yes.
I'm gonna just.
So
I'm
was
gonna
that
just
mutilation?
I'm gonna take a knee on this one.
Was that mutilation?
I'm gonna take a knee on this one because I can't make
Was it
out
mutilation?
which procedure she had done. So I
She
don't
had
want
a
to
double
respond.
mastectomy.
I'm with you on that, Christie. We
I
don't.
don't
Yeah,
wanna
I,
respond
okay,
to
so
that.
I'm concerned
Thank you.
that people might think that you're dodging the question. Do you agree that it was a mutilation?
I can't accurately give an answer because I don't know the actual situation
It was
that
a double
occurred. So I'm
mastectomy.
gonna refuse to answer.
I've told you it's a double mastectomy, and I grant that you
You
don't
also
answer
said it
this.
was you also said it was a tissue underneath the breast. So
Yeah, does double mastectomy remove tissue from underneath the breast? Yes, it does. So lock in and answer the fucking question. Did my mom
double
mutilate her
mastectomy
breast?
does not just remove tissue from under the breast. A mastectomy
removes-
is the removal of the entire breast.
Yeah, I understand that now, but it includes tissue, does it not? Was it incorrect
Don't
when I said that
don't
it
make
removed
don't
tissue?
mince the words around. No. I'm not answering. I don't have an accurate
Well, okay,
description of
answer
what
the
happened,
question,
so I don't feel
otherwise this is
comfortable
over.
answering. I don't feel comfortable answering a question
Did my
that
mom
I don't have the full
mutilate her
context
breast?
of. I'm sorry?
Did my mom mutilate her breast? Yes or no? Simple as that.
I don't know what exactly procedure she had.
She had a double mastectomy.
Well, you said she had something else, so I'm not going to answer.
No, I said that she had a double mastectomy.
Around now. Look, Kiki.
Chat,
want me
did
to go
did
get my
this
mom?
person say
Do you want me
that
to go
their
get
mother
my
had
mom?
tissue removed underneath the nipple?
I don't want. Look, can you stop involving your mother,
Do you-
please?
No.
Like, give the woman some dignity, man. You're in a live.
I fucking love my mother.
People.
But
Okay,
what
just
you're
move on.
implying
Take her
is that
out
my
of it.
mother mutilated her breasts.
I don't want to speak about
Let's
your
just move on.
mother.
But you're implying
Just
that my
let
mother
it
mutilated her
go.
breast, are you not?
Let it go, Derek.
What the fuck are you calling me Derek for?
I don't know.
Where is Derek from anyway?
Yeah, what the fuck is Derek from? My name is Keaton. People did bring up my mom because they implied that people who have breast removal are mutilating the breasts.
Okay, can we just move
Did you
on
not?
from
Yes
this?
or no? Did you imply that?
You implied that she got both breasts removed, and then you said she just had tissue removed. So I just respectfully, I don't want to talk about your mom anymore.
Did you imply that people who
Unless
had
it's going to be a
breast
your mama
removed-
joke. Unless it's going to be a your mama joke, I don't want to talk about your
Christie,
mama
yes or
anymore.
no? Did you guys imply that breast removal is
I'm taking a
mutilation?
knee. I'm taking
I
a knee.
grant that
Please
you don't
respect
want to
my
do that.
boundary. I'm taking a knee.
No, I grant that you don't want to answer that because it looks fucking horrible for you guys, considering the
Okay.
fact that. So I'll just make the positive claim that you guys did, in fact, imply that my mom mutilated her breasts.
All right, if you
Okay.
want to take that from that, then do your
That's
thing.
fine.
Move on.
You could clip it and
Well, then
put
you're
it on
sick
your
fucking
page.
monsters.
What?
Okay,
Because my
and
mom
you're
had
still-
breast cancer, and it saved her life. So how is it mutilation?
Right. Okay. Again, right? You're getting all up in your fifis. We didn't answer the question. You're
Yeah, because you
imposing that
refused to
on
answer
us.
it.
You're-
Let me ask you a
again,
question.
so
Your mother
you're
had breast
turning
cancer?
it into an
Yes, she had
emotional
breast cancer.
debate.
She
Right,
had
and-
unhealthy breast tissue?
I'm not exactly sure of what that all involves. I know that she had a biopsy done and it came back cancerous. It was either
Okay,
stage 1 or
was the
stage 2.
breast tissue unhealthy?
Well, it must have been.
Right. It was unhealthy, right?
So
Most of it wasn't. Most of it was still healthy.
Okay, so then we literally can't have this conversation. There's no context here. Anyway, We can
Well,
move
she
on.
had a double. So, but do you agree that it destroyed her breast?
Do you think? Do
'Cause
you
that's
think
what
a 12, a
mutilation is.
13? Do you think a 13?
Oh,
Wait,
I
hold on.
grant
Do
that you
think
want
a
to pivot,
13?
but I'm not going to
Let me ask you. Let me ask you a question.
We're not
I'm not
moving
going to pivot. I'm
on.
going to stay
No,
right.
no, no,
I'm
no,
going to stay
no.
right on this point.
No, I'm
Do you
not
think
going
a
to answer
woman?
any questions until you answer mine. Did my mom mutilate her breast? Yes or no?
No, because it was not. It wasn't healthy breast tissue. It was
I
unhealthy
can,
tissue that was
I can say
infected.
that.
It
I
was.
should have changed the word to removing, mutilating healthy body parts.
Yeah.
Healthy.
Oh, okay. So you finally answered the question. So why did you dodge for
Yeah.
so fucking long?
Well, I'm
I didn't
sorry,
dodge.
Derek. I'm trying to keep your mother's
My name's not
dignity
Derek.
intact, Derek.
My name's not. You know. No, I'm done with you.
Oh, just stop. Come on. Why are you doing that?
Because my name's Keaton. You can use my fucking name.
They usually they call me cock. I don't care. Why do you get so upset about that? It doesn't
Because
even make sense at this point.
have I called you names that you're not, Christy?
I don't. But even if you did, it doesn't. I'm a strong
Whose
person. I
life
don't
panel is
care.
this? It's mine, isn't it?
The point with the mastectomy, we'll get back and we'll wrap it up and we'll move on. The mastectomy is really simple. Your mother didn't cut off healthy body parts. It was an infected body part
did you guys
that
imply
was
that she
cancerous
did?
that could take her life.
Did you
So
imply
are
that
you going
she
to
did
compare
beforehand?
that? Hold on. Are you going to compare that to a 13-year-old girl that's going through gender dysphoria that cuts off her breast?
13-year-olds
Is that
aren't
the
cutting
same?
off the breast on large. Gender affirming care and
On
top
large?
surgery for
Wait. I thought you said every person counts.
yes, it does matter, but when these things are happening, they're happening generally at like 15, 16, or 17, and it's happening in like 1 or 2 people per year in the US. It is extremely rare.
It doesn't matter if it's 15 or 400 or 5,000.
And they have medically.
You just said every life matters and every person counts. So would you consider a 13-year-old removing her healthy breast tissue for gender
They
affirming
aren't.
care?
They
Mutilation.
aren't.
What do you mean they
13-year-olds
aren't?
aren't.
You sure you want to stand up? You want to die on that hill?
As far as I'm aware, 13-year-olds are not getting, top surgery.
They are though.
Are 13-year-olds getting top surgery?
I'm gonna show you. I'm gonna send it to you. I've sent this study out so many times. They do 13 to 17 years old in the United States.
Well,
That's
13,
with their minor
17,
age.
yeah, that's fine.
13 is in that. 13 is in that
Did
age
you have
range.
any evidence
13.
that 13-year-olds are actually getting top surgery?
Yes. You want me to send it to you?
Do you actually have evidence of a 13-year-old getting top surgery? Because I
Yes.
might be wrong about that, but I'm also just
You
gonna
are wrong.
appeal to.
Yes, I do.
Okay, so then I'll just say that it's medically necessary, and no surgeon would probably operate on this unless it was medically necessary.
But my question was, you wouldn't call that mutilation? Removal of a healthy body part?
I mean, if you're looking at it from a strictly biological sense, it could be considered mutilation, but I would consider that it's actually going to be in the benefit of the person long term, and that's based off of the evidence
The fact that we have detransitioners, and the fact that the studies show with
What's your detransition rate that you cite?
well, I mean, I think personally, and this is from things that I've read in studies, and I could send them to you. I think it's around 20 to 30% because there's no insurance code to code detransitioners. They kind of just let them go on their own.
Oh, so did you actually have any studies that talk about this?
I do, yes. There's studies that show that because there's no ICD code in insurance, they can't properly code a detransitioner.
Oh,
So they would
then we
keep them
don't
as
have proper numbers
keep them
about
as
this
well.
then.
They would keep them as trans.
So
on their-
we should probably not try to talk about numbers if we don't have numbers for them, because that would be.
I just said I have sources.
I hate to say this, but that would be negligent to do.
You're on my page, brother. That's what I'm saying. It is negligence to remove a 13-year-old's body parts.
No, it'd be negligent to talk about detransition rates if you don't have evidence about it. That would
I
be
just said this.
negligent.
There's sources that show it could be
Then
up to 30%.
Link me. Link them. Come on.
What?
Put it out. Put out. Stick out. Link me them. Come on.
Sure. Okay. And I'm going to show you the source that shows that girls get their breasts removed between 13 to 17 years old.
Yeah, I'm fine with them. I agree that 17, 16-year-olds and 15-year-olds, maybe even 14-year-olds do get it. But it can be incredibly rare that any 13-year-old would be doing it.
You can't say it's incredibly rare and then also say that every life counts in a prior argument. That's my point. Are you going to let
we
Envy
can
back
look at
up?
the rates of this too, and the rates are going to be incredibly low.
Hold on. Are you going to let Emily back up, or are you going to be done with her?
I mean, if she's respectful and doesn't call me Derek, maybe.
She's respectful. She won't call you Derek anymore.
Okay, then I will. If she requests back.
Appreciate it.
I'll invite her. There we go.
Don't call him Derek.
Yeah, I won't call you Derek.
Okay.
Eric or no? Okay. Sorry.
No.
Sorry. Come on. I'm just having banter. Yeah, I'm sorry.
Do you guys just agree with the fact that transgender people are targeted at all?
I would argue that every type of demographic of
they
human
are.
beings on the planet is targeted. Yeah.
But they're at higher rates than most other minorities. Agreed?
What
don't know
did you
if
say? I'm sending you first. I'm sending you the source on 13 to 17-year-olds, and then I'll send you the other source. Hold on, because I have that up now. Okay, that's one.
I'm just saying, if you ever do consider a name change, I think Derek would be good for you. So,
What should I change my name to be? Christopher.
yeah. And I'll be Menby.
I like that one.
It says 13 to 17-year-olds, but at the same time, it's not actually saying that anybody, if none of them are 13, it could still include into that range. It just seems that I've seen 13 to 17-year-old be a common cutoff among other, like, just studies in general.
No, you can't. It literally says in this, what I just sent to you, at least 776 mastectomies were performed in the United States on patients ages 13 to 17 with a gender dysphoria diagnosis. You can't just say, well, they just threw 13 in there. That's their bottom age. You can't just say, well, I don't believe it. I gave you the proof. It's with a gender dysphoria diagnosis without any other like no other reasons.
Okay,
why
it
they
could
would
be the
get that.
case. I would say that this is also, how many transgender people are there in the U.S. and youth? It's a lot compared to that, a few hundred. And yes, it does matter.
Again,
but we're also talking about every single
especially
person
children.
here.
When it comes to children getting their bodies mutilated, I would say that every child counts.
Yeah, do you know what happens when we don't let this happen, though?
Let me guess. Can I guess?
Yeah, you can take a wild guess.
They're unalive themselves.
Yeah, the rates go way up through the roof, and things such as like physical discomfort, mental discomfort, and other things just shoot through the roof.
Sure. Can you show me the source that they're unaliving themselves at a high rate? Because I've looked at every single number, and there is absolutely no indication or source that shows that they're taking their lives at higher numbers. Because of lack of gender affirming care.
Are they?
Yeah, I would say
tempted?
it's men that have the higher rate, and women have the higher rate of attempting, whilst men have the higher rate of actually it happening.
So
Yeah,
what
especially men that are first responders, police officers, EMT, people that have jobs that are like that have the highest rate. Army, military, those have the highest rate of unaliving.
That makes sense.
I'm sorry?
It's because we're not helping them enough. Because
Yeah, and I agree with you. They're not getting the help.
We don't help them.
That's not the only reason why. They have cardiovascular problems. They have pulmonary embolisms. They have STDs. They have an extremely high rate of, I think that mean age of trans people was like 42. Here, I'll send you studies that show, I have two studies, one that says as high as 30% detransition. Here's one. And then I'll send you the other one. It says somewhere between 7 and 30%, depending on the cohort. Let's see. And then it says also in the WPATH, it shows in the survey this is a survey. I don't know how accurate you guys like surveys. I personally don't like them, but 237 self-identified detransitioners, 14% had detransitioned before the age of 18. So the fact that like 7% of them, about 7% of them detransition before 18 shows that children obviously, first of all, can't consent and don't make the best decisions.
Well, is it that shows that they can't consent, or is that their minds are maybe not always made up fully, and that we should be taking, especially when people aren't sure, we shouldn't be taking, super large steps.
But the problem is that kids are sure, right? They'll say that they want to do this, like they'll say that they want to play a sport and they'll play it for 2 years and they'll be like, you know what, I don't really like this sport anymore. So we don't allow children to make medical decisions because it's not safe for them to do so because they could actually hurt their bodies.
Decision to detransition appears to be rare. The estimates of the number of people who detransition are likely overinflated due to research blending different cohorts.
Keep reading.
For example, I'm just looking for rates, and I'm not seeing anything right here.
I believe I sent you two, right?
Yeah. Well, I'm looking at the W path right now too. But the first one is, that one does.
Oh, my baby's crying. Hold on. Envy, you have a minute?
Yeah. I've got a minute. I've got to shoot down in like a couple though. Are you looking at something? But I didn't get the study or anything to look at, so.
Envy, I have to actually run now because I sent you the three sources, or two sources I think I sent to you. I got to run. My husband has to go to work and the baby's screaming. But if you want to have another conversation, Envy, you could stay up and finish.
Yeah, but I'm up and down as well, babe, because mum in it and food, and I've got to check the food. I've got to sort her out.
Do you wanna continue this conversation another day? I gotta get moving. My husband has to.
Yeah, we can do that. Do you want to do that? So do I call you Keaton? Did you say?
That's my name.
All right. Okay. All right. Okay.
Right,
but do you like the name Derek Keaton?
No, I don't particularly, because it's not something that I was.
It's like Derek Jeter.
Go figure. When you don't affirm somebody's identity, they don't fucking like it. That's a wild thought.
Oh, I don't care about my identity.
Yeah.
Well, not everybody cares about their identity, but people who do, like me, who I would like to be called my name, it matters a little bit.
All right. I'm gonna.
I won't call you that again. I won't. I was just being a bit bantery in it, so yeah.
All right, you want to reschedule for another time? We can finish this up.
Yeah, we can message each other about when a good time is, because Cole's not here either, and I know that they have a schedule.
I appreciate the discussion. Stop being so emotional.
Sensitive.
Yeah.
Well, when you imply that my mother mutilated her breast.
Bye.
No, I mean, like, you brought up your mother, and that we came to that conclusion that it was unhealthy, and she needed that, so I wouldn't consider that.
I agree that.
But okay, look, I don't want to talk about your mother no more. Respectfully, I really don't want to talk. I wish her all the best, and I hope she's okay.
Yeah, she's okay. She's been cancer free, so it worked.
Okay.
But
all right. Well, I'm glad. And I hope she continues to do well.
Yep.
All right. You have a nice day.
Okay, bye.
I just really quickly, from one of the things I heard while I was listening, because there is actual like non-consensual infant genital mutilation, or IGM, when you call a consenting, educated person who knows what the outcome is going to be and knows why they're getting said surgery, and you call that mutilation, you are taking away from the real lived experiences of people who never got to choose what their genitals would be like. And there are a lot of, especially intersex folks that had to deal with that in their lifetime. Yeah. And then one other thing, because there is somebody still in the comments that asked me this earlier, and I said, if you hang around till the end, I'll answer you. And I just saw him go by, so I want to answer him real quick. Because he's been like nothing but respectful and actually really helpful as well.
He said, okay, he just rephrased it with "How are you two people?" Okay, that's not. I'm not two people. I am one person. I know I am one person. Everybody who uses they them pronouns uses it in a singular sense for themselves. The reason we do that is because like if somebody left their wallet at like on a table at a restaurant and you were to bring it up to the waiter, you'd say somebody left their wallet here. You wouldn't be using he or she pronouns for that person, but it's still singular. So that's why people can use they them pronoun in a singular way. It's been used that way for a very, very, very long time. When you don't know what somebody's gender is, but you're still referring to them as one person, you use they them pronouns. That's how we speak. And being non-binary is just either being a combination of man and woman, not being a man or a woman. There are so many different identities that fall under the non-binary umbrella, and a lot of us do choose to use they them pronouns. That's all I'll say. Thanks for letting me up to say that. Also, can I show that you're around? Okay. It was so funny because I went to go make my grandma lunch and I was getting her something up on the TV. She's just sitting right next to me right now, actually. She said, "Can I watch the program you're watching?" So
Me crashing out. Hey, I want to watch that. No, I did crash out a little bit, but like, I don't know, when it's talking about people's lives, I think it matters.
Exactly. And that's kind of the last thing I wanted to land on. I'd already told her like what she was kind of getting into if she listened to it.
Yeah.
I now dislike envy for a couple of reasons I can state. But the one main reason is that she laughed when you were talking about literal shootings. Like again,
Yeah,
TikTok.
I don't get. I mean, we can say
You
it.
were
I haven't
emotional.
gotten warned for about and it's like
Yeah. Like
I don't
humans
care.
should be emotional when they're talking about that. Do you expect us to be like emotionless stone beings? Like
Especially
I
when
don't
they're
know.
like kind of throwing away the facts. I didn't know that the 29% of transgender youth have been threatened or injured with a weapon on school property. That's alarming.
Mm-hmm. And people are like, protect the kids, leave the kids alone. Well, do you want to protect these kids or do you want to ignore the fact that they're experiencing this at higher rates than we are? Yeah.
I mean, obviously, too, bullying rates are going to be much higher among transgender youth and other things.
But yeah, that's kind of just what I wanted to end with is don't judge people for having fucking emotions. Like we're human beings. And yeah, even if we're on live and you think something shouldn't affect us, whatever it is, like we're not you. You can't control us. We can't control you. Just let us have the emotions that we have and have the passion that we have and don't judge people for that.
How can you not say that they're not being hunted too when it's like such stark rates compared? Like it's clear that they're being targeted for that the only thing that's changed is that they're transgender and all of a sudden they're like massively more higher rates of being like twice as high of being bullied. And what is that, 4 times as likely to be threatened with a weapon? Like that is targeting at the very least.
At the very least. And it depends on how you would define like quote unquote hunting. I would define it as seeking out a certain type of person or group of people in order to harm them. When we're talking about it in this context.
Yeah, to be
And I
pursued
don't
or
know
searched
how
for is the adjective that Oxford Languages
exactly.
uses. So
And
it's like that clearly passes the 5 check.
exactly. You definitely like weren't exaggerating when you said that.
Yeah.
We can end stream whenever you want as well. I just wanted to kind of like share some final thoughts now that I was able to finish some work stuff.
We were at like 420 viewers at one point.
Yeah, it was pretty big in here.
Yeah,
My dad. I was
agree with the co-hosting thing in the future. It's hard to say though.
Yeah. We'll have to see how it goes. I've just never been we have never been in a co-hosting situation before. Definitely has its benefits, but anyways,
It's just frustrating to me that they just seemingly disregard like I don't know.
evidence and fact,
Well,
science.
just the number of people that are being bullied. Like these are children at the end of the day. Like
Absolutely.
even if there's something like even if we throw away everything and say that these people are completely delusional, which is not the case, they're still being bullied for it. We shouldn't be bullying people for something that, as far as it seems, doesn't appear to be something they can control.
Exactly. I heard a little bit of the Derek thing.
I don't know what's up with Derek. Is Derek just somebody that's like? I'm probably missing some context of what in Christie's.
Yeah, I'm sure. But you know
It's
how
like
I messaged you this
atheism.
morning too? And I was like, my parents have new names now. My mom is Norman and my dad is George. Because you know the first one. You mind if I share? Okay.
Yeah.
Yes, as in it's okay. Sorry, I'm asking my grandma real quick
Oh.
because she's related to the first one. She couldn't remember my dad's name when she was
Oh.
ready to get up this morning. So when she called for him over the monitor, she called him George. It's just the name that she chose when she couldn't recall. And then my mom was at work yesterday and she was on the phone with somebody, hung up, they called back, another person picked up, and the person that my mom was talking to said, I was talking to somebody else before. I can't remember. I think their name was Norman. And I'm like, how do you get Missy to Norman? So my parents are Norman and George now.
What do you? So she's your she's your grandma. What are you, their grand person? Is that what it is?
Grandchild is what
Grandchild.
we go with.
Okay, that works. Yeah.
Yeah.
I like the way they express themselves when they talk about these things. I'm very proud of them for expressing this in a sensible way that anybody who does not feel they want to touch their bodies in a changing way can understand. A granddaughter, which you are,
Grandchild, yeah.
and your was it transgender?
Mm-hmm.
My granddaughter is transgender, and she explained it, so I understood it, and I respect her for it, and I appreciate her expressing it so I could understand.
Are you talking about my sister Isa, or are you talking about me? Just so that I know.
I think you.
Okay.
Right now, because that's,
yeah. Okay. Yeah.
I also have another grandchild who was born male, but decided he didn't feel
That
male.
she's a woman, yeah.
And now she's a woman and lives with a woman in a marriage, and that is a beautiful marriage. So I would have no trouble with it, even as a grandparent.
And can I, if you don't mind sharing, can I ask how old you are for everybody?
I am 76.
Actually, you're 77.
Oh, I'm 77.
You're 77, yeah. And just that shows a little bit about how just having an open mind, trying to understand and learn, it doesn't matter how old you are. You can grasp these concepts. You just have to listen to people. And thank you for being proud of me. I love you very much. And thank you for choosing to share a little bit. Thanks for letting my grandma share some.
Hi, Grandma. I've heard lovely things about you.
God bless you.
So yeah, grandma is lovely. Thanks, Juno. Love grandma. Grandma for the win.
All right, and I think that's a good note to end on. So thanks, everyone.
Yeah.
Juno, I haven't seen you for that long, but He's here.
All right.
I was adopted.
Oh, that's a whole nother topic, huh?
All right.
All right.
Well,
I think
I'll
we're
see you
gonna wrap up
later.
the stream. And we can talk more later about stuff.
Yep.
Yep.
Bye.
See ya. Bye.